Everyone all set? I'd like to call to order the June 21st, 2021 regular board meeting of the State College Area School District Board of Directors. Please join me in the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I'd like to welcome everyone who's here with us this evening, as well as those viewing with us remotely. I'd like to announce the board held an executive session June 3rd and June 14th regarding negotiations and personnel. Board members with an agenda before you, are there any changes to the agenda as presented? Laurel?
Yeah, I don't know if it's feasible for tonight, but I do think that we need to go back to having public comment at the beginning of meetings, and possibly with a time limit of some sort. But I'd like to ask that by the time we meet next, we have had a discussion about this and begin to work towards that, or towards changing the policy we have, which calls for it at the beginning of the meeting.
Yeah. Thoughts from others? I'm comfortable with moving back in that direction. I do think we should have perhaps a way for people to sign up to make public comment, and maybe an agreed upon time frame would be a good idea.
So one of the things that I've seen is that they do like maybe 30 minutes of public comment at the beginning, the people that sign up, and then at the end of business, they open up the comment
Right.
again, so that there's, like Laurel says, there's a time limit up front.
I think
that makes sense.
Didn't we have some instances several years ago where we were doing that? Might have been when we did the extended day. We might have had a chunk of time set aside at the beginning, and then we went for half an hour, and then we conducted the meeting, and then those who didn't have the opportunity to begin the meeting were invited to be able to offer their comments at the end. At least that's the way I remember it.
You're right.
Yep. Scott?
Yeah, and then I guess in addition to that, there have been some emails, requesting information on when the public would be able to participate, in person in meetings as well.
Yeah.
So whether we tie that in with, the same consideration and make one
To do it, the change at one
change
time.
or whatever it might be, but that might be a good time frame to have that conversation as well.
I do think when we have people here in person that we should probably have public comment at the beginning, so that people who want to make a comment and then get going are able to do so.
Right.
Amber, could I add a thought? And that is just to be clear that, the reason for this is to be respectful of the time of the staff. It's not to, we'll all be here, but the staff members who are here to talk about things, we don't want them to be here till 1 a.m. if it's not necessary.
And that was the reason why we had made this shift a few months ago, was because
That's right.
we had administrators who needed to be in buildings early the next morning, and sometimes were, finding that they were introducing their agenda item at 10 or 11 o'clock at night because of the length of. But it seems like we could, with some time frames around it, it makes sense. Okay. All right.
And this is still conversations about this evening's agenda. That's what we're doing
Yeah.
right now. Comments about that?
I think that's up to the rest of the board, whether it would be for this evening or when we go back to having in-person
Oh, in terms of public
participation.
comment.
Right.
Yeah.
I was wondering, it's a while back now, we did sort of hand over safety decisions in terms of masking or all this kind of, these details to the safety team because they're epidemiologists and physicians. Would we do that with these decisions and then, get a recommendation because we don't have these background to decide these issues?
Public comment?
No, the meeting in person.
Oh, no, I think we're just talking about whether public
Yeah.
comment.
Oh, I thought Scott had said like an all-around package.
Well, he
of-
said tie it in,
Yeah.
but I think for tonight, since we're not in person,
Right.
that's the decision, right?
But-
But then I do have some feedback from the team, because I asked them about that.
Okay.
I mean, Amber wanted to make sure we had a chance for the board to weigh in on our steps for in-person.
Right.
So we did get some input on that.
So are you just we're just talking about whether we support public comment tonight?
I
At
think
the
that's
beginning of the
first
meeting?
question.
I don't know what we're talking about.
The reason I didn't suggest it necessarily for tonight, though I would be fine with it, is because I realized that I wasn't sure that we had a way to put people in order to be fair to people, to not, so I thought that's why letting people know that we do want it and we are working on the logistics of it. But I thought it tied into the order of the agenda because that's how the agenda is ordered. So that's why I mentioned it now.
And I think I wouldn't stand in the way of moving things tonight, but I would probably lean towards doing something for the future because I don't necessarily think it's fair to the public to make this change on the fly if they're expecting how we've been doing things for the last year, essentially, and then we suddenly make a change and maybe they miss their opportunity.
I think
for
we would have
comment
to do it
because they
both
thought-
times if we were to do it
And
tonight.
potentially, yeah, we might have to double it up if that was going to be the case.
Yeah, thanks for clarifying that.
Yep, that's a good point.
And I'll just chime in, I think the same thing goes with in-person, that I think we couldn't do it all of a sudden, but it would be nice to help people anticipate it for, let's say, whichever next meeting that takes place at. We really we need to take this seriously. We're hearing from the community that because of the mixed messages they're experiencing, at least about COVID and about mitigation, or at least the mixed messages that are out there about this, I think that we need to make, as our organization and our board needs to make a decision about how we're going to move forward with the support. We need to turn to the health and safety team to give us guidance in terms of the means by which we get to go back in person.
And I think we'll have that discussion with the agenda item on the safety plan to this
Okay,
evening.
Great, thank you.
Yeah. So in terms of moving forward, I think if we're going to have public comment at the beginning, we simply need to have, before we do that, I think it'd be helpful to have a sign-up system
Yes.
in place.
Right.
And maybe one that gives equal opportunity to people who are tuning in remotely and people who are in person to be able to sign up to make a public comment in order, so.
What do you think of, I think it was mentioned earlier about, so that we can get to our agendas, that if we block time at the front end, whatever the arbitrary time frame is, if it's a half hour, what have you, and then have additional time at the end of the meeting. I mean, and I know, I don't know if Scott's coming late. Did he say anything? He's joining by Zoom. Oh, he's joining by Zoom. Okay,
Okay, he
so,
is on the Zoom.
you know, in relationship to also putting additional time at the front end of the next meeting or something for items that are not on the agenda,
Makes sense.
non-action items.
Scott, did you have any input?
I'm comfortable. I was having a little bit of difficulty hearing some of it, but our obligation as a public entity is that we have some form of public comment in advance of any action that is going to be taken. So you're going to have a section during the meeting that will allow individuals to comment on anything that would occur that would be action tonight or at any meeting. What you do after that really is up to your discretion. You can have a second, more general public comment toward the end of the meeting, or you could even defer it to subsequent meetings, depending upon what's on the agenda and how long you expect the meeting itself to last.
Okay, thank you. Okay. So it's a consensus then that we'll work this into future agendas with a system for signing up. Okay. Okay. So then for our audience this evening, public comment is provided at the end of the meeting, but is also provided prior to any action items or votes by the board. And with that, Dr. O'Donnell will review some of the housekeeping items related to our format.
We kind of covered some of them.
Yeah.
We do have some of our administrative team. Thank you. I'll just touch on a couple things here. We do have some of our administrative team and our board here in the boardroom. This evening, we will continue our discussion when we get to the health and safety plan update regarding plans to return or how we would return to in-person meetings. During tonight's meeting, the IT help desk is available if the community encounters any technical difficulties. You may email itsupport@scasd.org or give us a call at 814-231-7743. Public comment, as Amber shared, may be made at the end of our agenda as well as prior to any of the action items. For community members who wish to make a public comment, please use the raise hand feature in the Zoom program accessed under the Participants tab. Thank you.
Okay, thank you. So at this time, we will call on our board secretary for a roll call of board members present.
Dr. Vader,
Here.
Ms. Bedell,
Here?
Ms. Brandt,
Here.
Ms. Concepcion,
Here.
Dr. Duffy,
Here.
Mr. Fazzard,
Here.
Mr. Hutchinson,
Here.
Mr. Leos,
Here.
Ms. Sidney.
Okay. And then at this time, I'll call on Dr. O'Donnell for the superintendent's update.
Thank you. So what I'd like to do, we do have the item on as the first information discussion item, and it pertains to an update from our health and safety team meeting this week. Right now, we're focused on the summer programming that's happening. In July, the state's requiring you to approve a safety plan. So we have a template, we have a draft. We want to bring that to you for the month of July, and that'll need to be approved by the end of the month. So obviously, the end of the month with the governor's decision, we're interested to see what the Pennsylvania Department of Health decides. We have some requests after meeting with the health and safety team, and I'll outline those in regard to in-person meetings. I'll also highlight their feedback, which is really consistent with what we'd be doing at the high school level here. In here. So after our discussion this week, we're recommending, we approve this update effective the 28th, the day after the governor's change, or the day of. I'm not sure if that's the day after or day of. So we have a limited amount of summer programs. It's about 400 students, as well as our extracurricular activities, which we don't have a total because they're not official programs. And some of the student athletes, for example, come in inconsistently or not at all. And we also have several music programs happening throughout the summer, too. So those particular numbers aren't in that 400. So as I said, we'll come back to the board in relationship to the state's requirement for the fall in July. Given the presence of the virus being lower, the team felt it was safe to make this update, and so here's the gist of what we're proposing. And I know Jean's online to answer questions. Vernon, Will, and Linda are here as well. For outdoor activities, the proposal is masks optional for K-12 students with no physical distancing requirement. For indoors, what we included was masks optional for students who are fully vaccinated, masks recommended for students ages 12 and over who are unvaccinated, masks mandatory for all students below 12 years of age, and masks mandatory for unvaccinated students in classrooms with students who are ineligible for the vaccine, so that all the students in that class, we wouldn't say that individuals are required. It would be the whole class. The next piece is no physical distancing requirements for K-12 with the exception of 6 feet during lunch, which obviously will be a challenge, and we will monitor that as we go through the summer, and in July, if there's a change, we would update that and why. Those are the key pieces that I think we need to highlight for you at this time. And again, that would pertain to the summer programs. Obviously, if we were starting the fall right now, that's where we'd be. And both the pediatricians and Matt Ferrari, the epidemiologist, were all on the same page with this. So, again, and the pediatricians are really dialed in on our younger students and with what they're seeing, and obviously they discuss this with their colleagues. and then they give us their input, and we really appreciate that. So this is a step forward toward normal, but that's where we are. And Jean, if there's anything you want to highlight there that I didn't say, I just pretty much hit the bullets there at the top of the memo. Is there anything you want to add? She's not on. Okay. Will, Vern, Linda, is there anything else that I mean, that was the gist of feedback, and
Okay.
so we'll
Questions then?
we'll
Yeah.
do our best to field your questions. And
Lori?
I just have a question that is just to help me understand. So no physical distancing with the exception of lunch. What makes lunch different for 6 feet? Like, do you know what I mean?
right.
What was the thinking there?
And really, we'll need to clarify that right now, we don't have many students. So again,
Right.
I shouldn't have made my comment about the fall, because this isn't the fall.
Right.
We don't have a lot of students. A lot of our programs are younger students right now. So we know we have a lot of unvaccinated students in our younger programs. So that's why the 6 feet's in place there.
Right.
We know that we have some unvaccinated secondary students. So it's really a precaution they suggested we keep in place at this time for the summer.
Okay, so I guess it's not so much about why 6 feet during lunch, but what's the difference between lunch and other times that they don't have to be physically
Well,
distant?
during the end of the year, we would have been able to move forward for the last 3 weeks of school with 3 feet, and that's pretty much normal with our individual desks. So
Okay.
that's where that came from.
Got it.
Vern?
Yeah,
I mean-
and just to add, obviously they're unmasked while they're eating, and so
Yeah,
you know,
okay.
at recess for a period of time too, students have been within that 3 feet or that 6 feet, but they've been masked at all times.
Got
and so
it.
that precaution has proven to be very positive for us. So,
Okay,
yeah.
that's a great clarification. And then the other question was, masks recommended for students 12 and over who are unvaccinated. So is that because a lot of kids will be vaccinated, so there's just a lesser risk of transmission? It's a numbers situation.
Yeah, it was a combination of the low presence of the virus, along with the fact that we believe we have a lot of students who've gotten vaccinated. We didn't, we have had a number from the summer program submit their vaccine card. We were trying to, obviously, we want students to be vaccinated. That's the advice we're getting. That's what we want to see in the community, and so that's pretty much it.
Yeah.
And
That's super helpful. And just for people at home, if you look at our agenda, you can see this under 6A. You can read this through just for clarification. So, yeah, thank you.
Are we asking questions about this now or during the discussion?
Well, now, because we've done safety team updates on the front end on the superintendent updates, so that's why we added it as info discussion for the agenda, and that this is really the key update from me to the board.
But we can ask you
Yep,
now?
absolutely, yeah.
Okay, so I
Yeah,
just have
thanks.
one question. And I thought Lori was gonna ask it, but then she didn't. So, okay, so it says, mask recommended for students ages 12 and over who are unvaccinated. So recommended and unvaccinated means that you don't have to be vaccinated and you don't have to wear a mask if you're 12 plus. But then the next bullet point says, mask mandatory for all students below 12 years of age. And so just from a sort of fairness, I guess, lens, I mean, I'm just asking, so why is it that you can be unvaccinated and 12 plus and not wear a mask, but you can't be, obviously they're not vaccinated because there is no vaccine yet for under 12, but they are not allowed. They do have to wear a mask. So what's
Right.
the
It was
difference?
Mainly because of the number of students. We have, all those students have access to vaccines, and obviously with contact tracing, you're not considered a close contact if you do have the exposure. But with that said, the safety team felt with the level of the virus, along with the access to vaccines, that we were safe to make that step, especially with where we are in the summer in our community.
So then
they
it's
felt-
simply because all of the people under 12 are not vaccinated.
And they don't have access, none of them
Whereas-
have access to a
Right,
vaccine.
right,
either.
whereas
Yep.
at least whatever unknown percentage is because of, okay, no, that makes sense, thank you.
And then the students, if you're in a classroom with students who are too young to be eligible for the vaccine, then you need to wear a mask
Right.
out of fairness to those students who are not eligible for the vaccine.
Yeah, that was the one piece, what we felt was we didn't want to discriminate and force some kids to wear them in the same classroom, others to not. And so that's why that gray area in the middle level is what we're
Right.
addressing there.
Where it says masks mandatory for unvaccinated students in classrooms with students who are ineligible for the vaccine, does that mean that did you intend for that to be all students in classrooms with students who are ineligible for the vaccine, or only mandatory
So-
for those who are unvaccinated in bullet point number 4? Because that would be the only situation in which you would need to be.
Yeah, I'm sorry, that
screening
does
for-
say that. I thought we had in there, all,
I believe it's all.
yeah, we need to,
So that, we should substitute the word all for, rather than,
let me,
where it says masks mandatory for unvaccinated students, it really should
Yeah.
be mask mandatory for all students in classrooms with students who are ineligible for the vaccine. Because that way it's not different rules for different
Right.
students in the same classroom.
I'm confused what that means. So does that mean that if there's a class with someone who cannot be vaccinated, then everyone in the class needs to wear a mask?
right. If they're not,
Old enough.
if they cannot.
Regardless of
access-
whether they're vaccinated or not?
Right.
If this-
Right, I mean,
In a classroom with students who are too young to be vaccinated.
right now in that room, we have in here unvaccinated. I thought we edited it to all. I wish Jean was here. I'm pretty sure we were saying all so that we didn't have mixed rules in the same room.
That might be a typo?
Yeah.
Mm-hmm.
I'm looking at the live Google Doc, and we didn't make the change. I know that was a pretty deep discussion because we felt like we would have everyone in that room so that we didn't have certain kids that had to wear masks. And the reality was we would be making in that instance kids who are vaccinated, which we didn't want to do. We wanted the vaccine to be an incentive, but in that unique instance, which we don't have a lot of those instances, but at the middle levels where that would be. And again, this is for the summers where we are now.
So the ineligible word in bullet number 4 there means not due to age, but due to other reasons?
No, it'd be due to age. It's really, so if you have an 11-year-old who's taking a math class with students 2 years older than that student, that's the scenario we're talking about.
Okay.
So not necessarily because,
It-
so if a student had a health condition per se, like I'm not
That's
sure
what I
what
was
that would
wondering.
be. that
And does
meant
that
they were
entire
unable to get-
class, whether they're vaccinated or not, have to wear a mask?
And really, our program right now, again, the majority of them are younger students and students in our special needs program. And in the special programs with students with special needs, we do have some cases where students can't be vaccinated and can't have a mask. So those discussions are happening with the faculty, our directors for special ed, and the families. So that's moved along pretty much status quo from the school year with those particular students. I know that's really unique, but the main situation if we had, and math one's not a good example because that's not the summer. So we don't really have, this is really unique. It's only going to be in those special needs programs right now because the younger students, I think there might have been 3 or 4 there's really not many middle-level kids involved.
Or if you have 12-year-olds that are part of the elementary summer champs camp. Or,
Yeah, that would be
very few, small
very few,
number,
if
yeah.
any, yeah.
So in that case, we're having all those students in the champs camp while indoors masked.
Right.
So because I know your document looks different than the one on board docs.
No, it's the same.
Oh, it is the same, okay.
Yeah.
Because right now, it does read, mask mandatory for unvaccinated students in classrooms with students who are ineligible for the vaccine. It does read as though if there's a student with a medical for example, hypothetically, there's a student with a medical reason why they cannot be vaccinated, then everyone in the room must wear a mask, whether that person is vaccinated or not. Is that what it's
Right.
intended to be?
Yep.
Got it.
So instead of mask mandatory for all students in classrooms with students who are ineligible. That's pretty much,
Okay.
Whether
just so we didn't,
by age or for medical reasons.
And this
Right.
is for now, not for fall.
just the summer, yeah.
That's probably important that we, emphasize that, because otherwise people are gonna not want their kid in a room with somebody who can't be vaccinated because they don't want to have their kid have to wear a mask the whole time, even though they're vaccinated.
But that could be where we end up,
But that's
not where we are right now.
not the point.
Right.
Yeah, I mean, the memo says summer, and it's really, I mean, right now, we might have 2 or 3 instances like this,
Yeah, it's very few, very few.
but they're probably even in the same group. So it's,
Scott?
So I guess a couple questions if we're going through this in kind of in detail now.
we are, yeah.
Okay. So, I mean, I can't stay up on all the changing guidelines from the CDC, Department of Health, whatever it might be. So just a general question of, are these guidelines as intended? We understand there's the one, item 4 that, that has typo in it. But as intended, are they in accordance with CDC guidelines? Are they stricter? Are they looser?
They're a little
where are they
looser.
in
They're
line?
looser right now in terms of, so when you become eligible, when students become eligible for the vaccine, from that point forward, the CDC is saying, if you're unvaccinated, wear a mask. We're saying a couple things. One, outdoors, masks are
Which I think
optional for all.
that is in accordance with
I don't-
CDC guidelines outdoors. There's
I
no
think
mask
there's a
requirement
6 feet
outdoors.
piece still in oh, isn't there? But
I'm
regardless,
not sure,
it's
but I thought-
probably.
I thought masks were gone outdoors for the most part.
So instead of, what our team has said is where everybody has access to a vaccine, masks optional.
Right.
That's the difference where the CDC is saying unvaccinated indoors, less 6 feet mask, right? And ours says optional once you have access to the vaccine, once that age point hits.
Okay.
So that's the key difference.
Okay.
The mixed age area is right around that age of 12 for now is funky, and that's the gray area one right now where we didn't want to delineate in the same class and put that on the teacher.
I fully get that, and I guess my consideration would be, is if we only have a couple cases that we're trying to encompass with this, would we be better off putting a more general statement in there that, select cases will be evaluated on a case-by-case basis versus having this spelled out like this? Because my concern is, this is the summer plan. It's very obvious it's the summer plan. It's very obvious this isn't the fall plan, but people are gonna look at this and they're gonna extrapolate into the fall. And are we setting the stage for a line of thinking for the fall that, whether, I'm not saying I agree or disagree, but
Right.
I'm concerned that we're setting a parameter that might be very challenging to justify or to follow aside from these 2 or 3 cases versus just identifying those as exceptions and dealing with them as exceptions. I'm just trying to think
Well,
of how
we
to
did-
simplify where
we
we don't
did,
paint ourselves in a box.
Right. We did put in here, we'd like to have some flexibility. That's why we added,
It says in here, the board authorizes the district administration in consultation with the health and safety
Right.
team to revise plan protocols accordingly.
so we, rather than to come back to you to make changes, if the safety team, when we're meeting with them, say the numbers continue to go lower, and when after the governor's date, the DOH changes, and this, I don't know if the CDC is going to make changes in the summer. We expect changes coming from the Department of Health. We don't know what they are yet. They have not sent us anything. But we were just hoping that, depending on those, either way, because if this Delta variant did hit us, we'd have the ability to make some changes at our level and not have to wait or schedule a special board meeting. So that, we're a little bit more, a little looser than the guidelines right now with this proposal, and it's a small step, but this is where the younger students, the team, our nurses, our physicians, and Maciek couldn't be there, but Matt was there. That one of the epidemiologists were all on the same page, just because of no access to vaccine.
Yeah. And I really feel like it's important to continue ensuring that we're protecting kids who have no access to vaccines. Laurel?
Yeah, I was wondering where adults fit in here. So if you're an adult who perhaps can't be vaccinated, how does that affect the students in your room?
Well, that person, mainly teaching younger students, we still have all of our PPE. Right now, we have access to, the
The N95s?
KN95s, yes, sorry, thanks.
So it only is if a student can't be vaccinated. So if you had a classroom of students who were eligible not to wear masks, but their teacher for some reason or other staff people couldn't be vaccinated, the kids still can have that option, the 12 and over kids.
Can you clarify it? So it's 12 and over, it would be
So
optional.
For the children, for the 12 and over children, even if their staff member could not be vaccinated. I think this
Right.
is sort of a
You know-
variant on what Gretchen was saying. When we say ineligible, you can be ineligible by age, or there are certain other reasons you could be ineligible, allergies and such.
And right now in the summer, we're dealing mainly with special needs programs. So for the older student population that in our programs for students with special needs, it's pretty much status quo right now from the school year and the conversations with the students and the parents, because we do have a number of those students who are immunocompromised. So there's really a dialogue with those situations. So we still do have some instances where people are masking that are employees. Although almost all of our employees are vaccinated, there are some that are not. So those are discussions with our directors of special ed and the employees and the student families that are in those programs.
And then the other thing I wanted to clarify, particularly because a lot of people look at our guidelines in terms of what they do in their home, even if it's not, just to get a sense of what our safety team is saying. It looks to me like we're saying that if you've got children who are masked, it's fine for them to be playing close together indoors. That the mask is more protective than the distance. Is that accurate? Because it says the only time for the distancing is at lunch.
The mask plays a key role in this, obviously, and as well as the lower level of presence of the virus. So it was a combo, and we have seen the recommendation for us to be able to go to 3 feet late in the school year. So we're really doing what we could have done down the home stretch of the year with really 3 feet, which is pretty normal because we're.
So, but it doesn't mention the 3 feet anywhere. It just says that only during lunch do you have 6 feet.
Right.
This would make me think that during, the rest of the day, it's fine for you to be right next to each other
Right.
as long as one way or the other.
Well,
That's
and
accurate.
right now, you and David are probably close to 6 feet.
Yeah.
And, 3 feet isn't very
But
far apart.
The 3
So-
feet isn't in here, though, is why.
No, it's not, because our team looked at that as we're regular.
Okay, I'm not sure.
Guys, is that,
Clear with
how do you?
I think to answer your question, Laurel, a little more specifically, the only time students will be required for 6 feet of physical distancing at the elementary level will be at lunch. There will be many times where they're inside of that 6 feet. What will remain consistent is the wearing of the masks. And the other metric that our safety team used in making that decision was also the low transmission rate within that age group. So those were the, in addition to the factors Dr. O'Donnell mentioned, this was kind of the third factor, was the extremely low evidence of transition rates within the age group of 2 to 11. So The only time students will be definitely maintaining the 6 feet of physical distancing at elementary will be during lunch when they're unmasked.
Because the assumption is the rest of the time they're masked,
Correct,
basically.
correct,
Okay, that's, I
absolutely
think, the
correct.
piece that,
Yeah.
so basically for people who are following along at home, our safety team says the masks are more important than the distance in effect.
Can I speak up? I'm sorry, I just
Hi,
got in
Jean.
here, just got
Hey,
the link,
Jean.
I apologize. I would say that the big piece here with the 6 feet is really contact tracing. So when we're talking about contact tracing, that's the only time we use a measure. So the masks does prevent the spread. And so when we have a contact tracing, we would still quarantine people or isolate people who weren't vaccinated, and those that weren't vaccinated have a lesser chance of getting it by being masked. And I hope that helps.
But, to clarify, Jean, the students who have been within 6 feet of each other would be contact traced then?
Right.
Correct.
Yeah.
Correct. But our numbers are so low that I feel as if we get closer to having higher, as our numbers go up, things would change, right? We would really
Right.
monitor that very closely. So if our numbers are going up, we're going to increase what we need to with mitigation.
That makes sense. Dan, did you have your hand up?
Yeah, I was just thinking about the idea of contact tracing and the 6 foot interval and so on, and 6 foot interval at lunch. And for the kids who are masked for many indoor activities, but at lunch they're not. Even with the 6 foot interval, if you have to do contact tracing, they're more likely to have had conversations in a relatively enclosed setting. So it would be valuable to have that greater distance and recognize that when they're at lunch, they'll be not going to be masked in that activity. So it kind of ties into the idea of risks or the possibility for spread, at least in those kinds of settings. I just want to add one other piece just to reinforce the idea that the nursing staff and the physicians, the pediatricians, and also the epidemiologist kind of recommended masking for kids below 12 years of age in indoor settings, and that aligns directly with what the research I was doing today on the CDC website. So they are up, that essentially corresponds, their recommendation corresponds very closely to the recommendations from the CDC. So anyway, I just thought I'd throw that in.
Scott?
Just one other question or point of clarification. So the health and safety plan from June 7th had a requirement for providing proof of vaccination. I don't see that in this version, and I'm just clarifying that that has been removed because that was an item that, I felt strongly about, and I'm just making sure that I didn't, that has been removed and it's not just something that I'm missing.
In here, since it says masks recommended for students 12 and over who are unvaccinated, if you did take action on this, we'd in essence not need to ask for that.
Okay.
Because if we have the requirement for the first bullet and the second bullet was requiring unvaccinated, then we'd still need to collect that information.
Okay.
I think what we do want to do is continue talking to the safety team about what information do they need to make a decision for the fall if they really believe it would help them to understand how many students are vaccinated, then we may continue asking for it. I don't know if we'll ask for images or if we would ask parents to just let us know on an honor system, but we haven't gotten there yet for the fall.
It does say that we will continue to ask students to report when they are vaccinated to help with contact tracing. So
It would help really with contact tracing, like, to the point that Jean said earlier. One of the reasons we want to have evidence of who's been vaccinated is it would help our nurses. Well, technically in the fall, the DOH is supposed to pick up all contact tracing. We'll see if that, I mean, if the presence of the virus is that low, then maybe they will. So, but that'll be a good sign for us in regard to what we'll be able to do to keep moving forward.
in the previous version, I think it said that masks would be required for any employees who were unvaccinated. And is that still the case since this only updates student information, we're still requiring masks for unvaccinated employees?
Jean, for, I believe above age of 12, it's everybody in that program, or did we?
Correct.
Okay, so it would include
Correct.
employees optional as well.
Yeah, I think we exchanged the name for individuals, any individual that is vaccinated eligible.
So, for example, then, an unvaccinated staff member in a room with elementary schoolers is going to be wearing a mask
Correct.
for sure.
Correct.
Right, okay.
So to that point, do we want to potentially change the terminology in the bullets from students to individuals?
Right.
Because then that would include, again, that's just if the intent is that this includes staff and students. So only if that's the
Sense.
intent. If that's not the intent, then we probably need further discussion on it. But if that's the intent, then we could change
Right.
students to individuals and cover quote-unquote everybody. But I want to make sure that's not,
No.
that's not an unintended consequence that we're creating by changing it.
Right. Jean, I don't see a problem with that, do you?
I don't see a problem with that. I think that the key piece that we need to keep in mind is that it really comes down to our numbers in our community. As soon as we see any kind of trigger of those numbers going up, we're going to have conversation and really talk about what we need to do. And that's the key here, really.
That's helpful to hear. Laurel?
Sorry, two thoughts for the future. One is if we could work with maybe Chris or someone to get some graphics, because I think we're even having trouble piecing out the things, but be it a flow chart or something that makes it a little more understandable to people. And the other thing is that when we do come back for the fall, this sort of goes to what Scott was saying. In cases where we are either significantly tighter or looser than whatever the prevailing guidelines are, it would be nice to have that noted, because it is a question I've had and we've gotten from other people, and I think there are often good reasons that we're one way or the other. But noting that, I think, is worth doing.
So
I totally
essentially-
agree, for sure. We're definitely going to communicate. That's been our number one thing the whole time. Anything changes, we'll definitely communicate that and why.
It does sort of
Laurel,
seem like a
you're
Venn
asking for
diagram
where
could
do
be.
we differ from the CDC and DOH, though? Right. Some of the, right,
Like
some
when we're
of
ready
the
to communicate
challenges
the
will
fall
be
plan.
just when's the DOH and CDC differ, and, I mean, so, I think it depends.
Mhm.
So, but I do think communicating, obviously, right now, we don't have a lot of students in our buildings. You know, some buildings don't have any students at all in them. For, when we come back in July, you know, our intent as the board approves any fall plan, our fall plan would be that's obviously communicated, and we could delineate that per level. It looks like if the vaccines are still as they are heading into the fall, if there is a different restriction or a different requirement on ineligible age-wise, then, you know, we can send that out and serve that up directly to those families as well.
Okay. All right. Is that all for questions?
I just have
and-
one
Sure.
quick question. So, because of the criteria for if the students are not eligible, under 12, they're not eligible because they don't have access, then anybody has to wear a mask. So does that mean that in a classroom setting for a teacher who is with students who are 11 and younger, the teacher wears a mask all the time?
Even if the teacher's
Even if the
vaccinated?
teacher's
They're-
vaccinated?
If they're vaccinated, they wouldn't need to wear a mask.
They wouldn't, okay.
So then we don't want to change this to word students to individuals in this. We actually need different employees.
Yeah, I was confused about what Scott brought up, like the students versus everybody else, like staff and teacher, whoever, you know, everybody, because you
Well-
can't tell, like, who are we talking about?
Right, well, masks optional for individuals who are fully vaccinated, I think works, because then it gets progressive there. Masks recommended for individuals age 12 and over who are unvaccinated, masks mandatory for all individuals below 12 years of age.
And I guess under that
Which
bullet four,
that
it
could be
says
students,
mask
obviously.
mandatory for unvaccinated students in classrooms with students who are ineligible, so it
That-
doesn't
That would be
say
all students in classrooms or
Students.
students who are ineligible.
but it
for-
doesn't
And that
say
could say,
staff, and so therefore teachers who are
that,
vaccinated.
that one could be individuals as well. So for all individuals in classrooms with students who are ineligible for the vaccine.
So even a vaccinated teacher in an elementary classroom needs to be masked?
Well, yeah, that one, no. That
So
would
we
be the
might just need an
teachers who
extra
are
bullet point.
unvaccinated. So we probably need to just say all students in that scenario. Our approach to the employees will,
Is separate. Okay. Would it help to simply have another bullet point under masks optional for all students who are fully vaccinated, masks optional for all employees who are fully vaccinated?
I think that
Do we
would
need
make
to
it a lot
say
more
that
clear.
masks-
just,
Is where it
how
says
about-
masks are mandatory for all students below 12 years of age. And they're mandatory for employees who are unvaccinated with students who are under 12 years of age, right?
No, I thought I heard Bob say that if a teacher is vaccinated
Right.
and in a classroom with kids under 12, that teacher would not have to wear a mask.
right.
So actually, I think that in those 4 bullets that we're talking about, if the first 3 were changed to individuals and the 4th one was left as is with the change of mask mandatory for all students in classrooms, then it's students, it's not teachers. So then it's fairly specific that the first 3 represents everybody,
Yep.
and the 4th bullet is solely related to kids in the classroom.
That makes sense.
I think the challenge of the mask recommended for individuals ages 12 and over or unvaccinated needs to be students because, well, the challenge is in the elementary schools where we have someone, we just have to deal with the employees who are unvaccinated in the elementary schools because right now the lack of access to vaccines. So do you want to
Or sixth
recap what
grade.
you just said?
So I guess, again, I'm under the context that we're not changing the intent of what the safety team was looking at. So based on this conversation, I would be changing students to individuals, this is all under the bullets under indoors. Students to individuals under bullet 1, students to individuals under bullet 2, students, actually, I don't think you have to
That doesn't
change, I
matter,
don't have to
yeah.
think you have to change item 3, and I don't think, and then item 4 is mask mandatory for all students in classrooms where someone, is ineligible.
But does it, I think it may also need to say, in addition, it might need to say mask mandatory for all students and/or unvaccinated employees.
Right, that's what you were getting at, was if you have an unvaccinated employee in a room with people, kids under the age 11 and under, they too should wear a mask. Yeah, that can't be optional because they're with younger kids.
'Cause I don't think that's captured in any of the other bullets.
Right, right.
And how about if we can put a hard copy in front of you here in a couple minutes. So the 4th bullet, as it reads, masks mandatory for all students and unvaccinated employees in classrooms with students who are ineligible for the vaccine.
Yes, that makes sense.
That's it. Okay,
And it clears up confusion.
Mm-hmm.
thanks for your patience. So this was a guidance counselor and 2 math teachers that wrote this late on Friday. So thanks for bearing with us. Obviously, we're in the summer and we're encouraging people to use their vacation time. And so, but I think I'm the one that typed that bullet. So thanks, and I would appreciate Vern and Will for helping us get to this point.
There's a lot of complexity with this. So.
Yep.
Yeah.
We were trying to make it concise so we could people could wrap their heads around it, but sometimes when you go too concise, it's not clear.
But I do appreciate that the health and safety team is looking so carefully and closely. That means a lot.
Well, they've committed to continue meeting on weekly because we know things are going to change through the summer, and we appreciate that we're also itching to change too, and we know the community is, and with what we've seen outside was why we made the change before graduation. And, you know, we've been watching outdoor experience for a year now, and we felt good, and the safety team supported it. And right now, this is, you know, we were curious, I think Gene included with those in the room, whether the team would support optional K-12 or not, and why. And but they were on the same page with maintaining masks where we can't access the vaccine. And you know, although the data is very low, there's still some people in the hospital, and there still is some presence, but it's, you know, it's going in the right direction. And we're not talking about many kids that this impacts. I mean, this is the summer, and I think those of you who emphasize that, you're spot on. This is for about 400 kids, not 7,000. And we'll come back and talk about 7,000 soon enough.
Yeah.
Um,
Yep.
And we believe things will change the last week of June. We have not heard what the DOH's response to the mask mandate being dropped will be, and will their guidelines change? We would expect that, but we're not there yet. We know that some counties have departments of health offices that are advising their school districts to make masks optional during the summer months. I know where Dr. Stout's going, they have a really high rate for vaccination, and that's a recommendation. But we don't have a Department of Health for our county. Our Department of Health really are the epidemiologists and physicians helping us out. And so this is where we are at this point in time, and it's a step.
Okay.
So later on the agenda, if you're in support of it, we'll run some paper copies just so you can see exactly what we're asking. If you did approve it, then we would then begin this on the 28th, I believe we have at the top of the memo.
Yep.
Yeah, June 28th.
Great.
So we'll get that to your places here shortly.
Okay. So
Thank
that way
you.
we'll have that before we get to that item on the agenda.
Thanks, Vernon. Will, you're going to miss this stuff. Before we move on, I do have another communication item, and it really pertains to Vern and Will. And you know, this is their final 2 weeks with the school district. So I just wanted to make a couple remarks. During the past 5 years, we've been very fortunate to have two very gifted educational leaders as part of our school district, serving in the roles of elementary and secondary superintendent. Obviously, both helped us work through the pandemic and continue, and have been key supports and leaders of our administrative team, and obviously our faculty and support staff, and we're greatly appreciative. Vern joined the district 5 years ago and was instrumental as we worked through our community to figure out the student day changes, as well as some key curriculum updates. He's been a big help with adjusting staffing decisions based on evidence needs of students and not simply enrollments. Vern also helped us work through several construction projects as we had plenty of programming and people-related challenges during that time period. Vern is heading back to Frederick County Public Schools, the district where he graduated from high school and began his teaching career, as well as where his mom and two siblings reside in Winchester, Virginia. And I also know his wife, Jen, and he met while they were teaching there. And Jen's also returning to teach there as well. So due to all the time we've spent together working, I've obviously gotten to know Vern well. And although I know we'll keep in touch, I'll miss him very much. We appreciate all that he's done for our school community. So thanks, Vern.
Thank you, Vern.
Will joined the district 4 years ago and has been a calming influence on our team, even during some tense time periods within the pandemic. I think that's his counselor background. He helped us to map out and begin our strategic priority review, our middle level model. Obviously, we need to recommit to that process in the future, so I just wanted Will to know that his resignation was approved contingent upon helping us with that process. Kidding, Will. Will's also returning to the area where he grew up. Actually, he'll become the superintendent one town away from where he grew up, in the Owen J. Roberts School District in Chester County, Pennsylvania. During his time here, we've also worked together closely. Also, Will and I collaborated for several years now in prior settings too. So this is this technically concludes our 12th year of working closely together. As with Vern, I'll miss his perspective and insight, but both will always be on a call or email away. Many people have gotten to know Will and Vern well in our school district and the community, so you know their character, personality, knowledge, and what they brought to our school district. And you also have an understanding of how big those shoes are and the challenging transitions that we're facing. So thanks to both of you very much, Vern and Will, and for all that you've done here, and I wish you well with your next role. I'm sure you'll continue to do wonderful things for kids and educators, so your future communities will greatly benefit from both of you. So thanks.
Thank you.
That's all I have under communications. Thanks.
Okay. Board members, any communication items?
I had one.
Great.
So I just wanted to give a shout out to Champs Camps officially started today at Coral Street Elementary. And I don't know what the numbers are, but I heard it's bigger than it ever has been before. And considering the amount of traffic flow in and out and buses, and I mean, it was phenomenal. And the teachers and the staff and Jonathan Klingman, they just were phenomenal. And it was a great start to a great summer Champs Camp. So it went well.
Thank you.
Thanks.
Okay, legislative update. David and Lori.
So the biggest action on the Hill is around Senate Bill 1. Through the efforts of PSBA and PSEA as well, we were able to stall the flow charter reform process that was Senate Bill 1. Although the measure remains on the voting calendar for the next couple of weeks, so it is by no means dead. It is important that we keep up the pressure to tell senators to reject this bill. It's what is so frustrating, I think, to educators across the state. We've had over 400 districts vote for charter school reform, and this legislation actually takes us in the opposite direction. And so it's deeply frustrating. Also deeply frustrating at a time when we are nowhere close to equity in terms of our financing. That related bill, and Lori, you probably have the number right in front of you, is actually taking public tax dollars in support of private and charter schools, and it's inexplicable what the defense of that is. So we appreciate any effort that can be made over the next few weeks. Things this time of year in Harrisburg, things can happen very quickly, and so it's important that we keep up the pressure. And again, I just want to mention the fact that there's real unity on this across the educational spectrum, from Teachers Association to School Boards Association, and it really would be nice if our legislatures were paying attention.
Thanks, David. It is astounding to see what's happening in Harrisburg with this as part of getting an attempt to bake this into the budget process, especially with what school boards across the state have been saying emphatically. So I agree with you. This is very sensitive, and if it did go through, would impact us and our community big time.
I probably should have mentioned one of the key things that we thought were so important in terms of charter school reform is the idea of having transparency and understanding what the process is and what's going on in both the budgets and the academics of charter schools. And this removes any kind of accountability. Whatever limited amount of accountability there used to be over charter schools, this would remove any local public ability to oversee that.
What transpired here with Wonderland, we wouldn't have been able to do that. We'd have 10 days for the board to approve the renewal from the date we received the request. 10 days. So to have a site visit and a review, you couldn't do that. Right now, we basically get the request in October, and then we schedule time to do the site visits and review all the documents, have back and forth asking for more information, and to fit that process in within 10 weeks and have a board meeting with action would be not feasible.
Impossible.
And there's no indication that they're looking to create a state-level review board for charters that's going to go into these schools and like have, significant monitoring and really getting into the data and understanding their budget process and student achievement, or when I think of some of the kinds of, details that we were able to understand in terms of how Wonderland was operating was due to, really studying the data that we had from that school, the budget data and the student achievement data,
Right.
as well as the site visits that
Yeah.
gave us some insight into their approach.
Directly observing students in programs where questions regarding the adequacy of those programs just jumped out at you. So,
And what you supported with the Regions Board doesn't hurt charter schools. It actually just tried to clarify some of the funding pieces with special education. Obviously, the transparency piece helps kids. And, of all the public school entities, that's the only one that doesn't have elected officials as part of their boards.
Automatic escalation of funding as well, which we don't get as a school board.
25% per year escalation of funding for EITC money.
Yeah.
Yeah, you're right.
Well,
This is-
that would
And
go to,
there's-
I believe, private schools as well,
Right.
right? That's not
Right.
just,
Well, yeah, there's,
Private and religious schools,
Right.
correct.
yeah, Senate Bill 733 is the voucher program, too. So there's two, SB 1 does EITC money, and then there's a voucher program that also takes money and sends it to, allows people to use it for private schools.
Right, it would take money it would divert money from the public tax funds into the support of private and religious schools. And there's an automatic accelerator in the amount that was allowed to do that from year to year, when there's nothing in the state budget is automatically accelerated. And the fact that they're allowing to divert more funds each year, it's mind-boggling, honestly.
And what I found really surprising about it was not only vouchers for attending private schools, but that students could use those taxpayer dollars for any number of different kinds of educational
Oh,
expenses.
yeah, they could put it into college savings funds, yeah.
SAT preparation, I
Absolutely,
mean,
yeah.
anything, yeah.
So it was,
It's a lot of loose money from the taxpayers.
right. With, I think it seems like little accountability for how it would necessarily benefit students, so.
Right. Right.
Okay. Gretchen, do you have a COG report?
Yeah, so the General Forum has not met since our last meeting, but there was something from the General Forum May 24th meeting that I did want to bring up just for the SCASD community to be aware of. The COG has been working with and listening to and inviting to various meetings. It's a group that, and I think David knows more about this than I do, because I think you attended one of the meetings, so I'm going to hand it over to you in a sec, which I should have told you about before the meeting, but they work on diversity and equity, and it's, the COG has really been reaching out and saying, we want to hear how we can make our meetings more accessible, and what can we do as a governmental entity. And apparently there was a meeting, David, that you attended pertaining to this topic?
Yes, if I have it right, and I'm hoping that I do. And one of the things that I conveyed to them is how helpful it is to know that we have community support around this idea, and that, this is something that the school board is interested in, has been interested in, and the fact that, but you can't do a thing outside the support of the community. And so for them to really rally public support would be really helpful.
So that's just, I just wanted to bring it up so that, I know the school district has been working a lot on these issues, and various townships have as well within their boards, and so has the Council of Government. So it's happening everywhere.
It's great to hear that COG has working on, has some organized approach to it as well then. Okay. All right, then, any other communication items from board members? Okay. Then we'll be looking for a motion to approve the routine approval listing as presented on the agenda.
So moved.
Okay, that's
Second.
been moved and seconded. Are there any questions or discussion on routine approvals? Laurel?
Yes, I had a couple, and I'm sorry I didn't get them in earlier. On the service contracts, one is the inspection of telescopic bleachers, and I was just wondering if that's an annual thing or more like a periodic item.
And that's on the
I hope you can hear me. My connection's a little
We can hear
spotty.
you, Ed.
That is an annual.
That is annual, okay.
Thank you. That is an annual service contract, yes.
Okay, and then the other thing was, I appreciate the explanation on the reason for the desks in terms of changes with the pandemic, but my question is what had happened to the desks that had been removed previously before the tables? Why are they not still around?
We had no place to store them in the district and had no idea that pandemic would ever require us to make a quantum shift back to desks. So they were recycled where we could and disposed of where we couldn't.
Yeah, this goes to the general issue of what we do with things that we no longer need. That is a real problem. If we need them now, we need them now. And then I had one other thing with the technology, and that is the 4th bullet item under IT services for FY 2021-22. It says in an amount to exceed. I assume the not is missing. All the others say not.
Yeah, that would be.
Okay, well, I wanted to check because I actually didn't notice that at first. I just noticed that the others were all renewals, and I didn't know if this was, again, an annual purchase or a one-time, and then I happened to notice the not part.
Good catch.
But my main question had actually been whether it was an annual or whether we were redoing a whole bunch of people.
So you're which line item, Laurel?
It's the 4th item under IT services. It's the identicards.
BP. So those are for, we print student badges each year.
Okay,
So that's just for all of the students. That's a pretty typical yearly expense.
okay. And it will not exceed.
Will not.
Thank you.
Okay. All right, any other questions on routine approvals? Okay, is there any public comment in regard to routine approval items? Okay. Then we will have a roll call vote on those.
Mr. Leos?
Yes.
Ms. Sidney?
Yes.
Dr. Bader?
Yes.
Ms. Bedell?
Yes.
Ms. Brandt?
Yes.
Ms. Concepcion?
Yes.
Dr. Duffy?
Yes.
Mr. Fazzard?
Yes.
Mr. Hutchinson?
Yes.
Okay, that item has passed. Moving on to action items, we will need a motion to approve 3 board members to serve as SCASD voting delegates for the 2021 PSBA legislative platform as shown in attachment 5A. But first we need 3 board members to volunteer to fulfill this. And Laurel, did you tell me that you were
I said I would
willing?
be willing to.
And I was going to say, at
I
this point, I'm
certainly
gonna
don't
start
want to
picking-
displace anyone.
Anybody who spoke up along the way. I'm inclined to do it again, but I've done it. It's a great opportunity to really wrap your mind around the entire Commonwealth in terms of the 500 school districts that serve students in the public education system.
Yeah.
And they're unique and a level of diversity that's only comes through the comments that occur during those deliberations. I think it'd be valuable for any of us to experience it. I've done it a number of times, and I'd be happy to defer to somebody else if you'd like to pursue it. One of the nice things about it can be done by Zoom as well as in person, rather than actually having to be there for the delegate meeting.
Is there anyone who hasn't done it before or who wants to do it? So Deanna, I might count. I'm willing to do it, but I don't want to take a spot from anyone else who wants to do it.
Well, that's kind of my take on it, too.
You've done it, right? Yeah. I've done it before, too. Anyone else?
I took a couple of years off.
Okay, so,
I'll be happy to step up then if needed.
and David, you said you had a conflict on
I
that.
do have a conflict, so I just I'd be happy if someone else did it, you know.
Okay. So Laurel, Dan, and I would be the potential volunteers then. Okay, so
Do we need a motion for that then?
could you make a motion in that regard?
I could. I motion that Laurel, Dan, and Amber be the delegates for the PSBA conference.
I'd be happy to second that emotion.
So that has been moved and seconded. Any questions or discussion on that motion?
I think these are fine people.
Thanks for the confidence, Jim. All right. Is there any public comment on this item? Okay, then we will have a roll call vote.
Ms. Zidney.
Yes.
Dr. Bader.
Yes.
Ms. Bedell.
Yes.
Ms. Brandt.
Yes.
Ms. Concepcion.
Yes.
Dr. Duffy.
Yes.
Mr. Fazzard.
Yes.
Mr. Hutchinson.
Yes.
Mr. Leos.
Yes.
Okay, that item has passed. Item B is a motion to affirm that the board intends to retain Dr. O'Donnell for an additional 5-year term, and we have a memo attached in 5B.
So moved. Second.
Okay, that has been moved and seconded. Any questions or discussion? Jim, were you gonna, you look like you were
No,
gonna say something. Sorry.
no, I just think we got a little bit behind with all the COVID stuff, and obviously this should have been done a long time ago, but, yeah, know that we're in support of you, Bob.
Yeah.
Thanks, Jim.
And I think, like, how grateful we all are for the service you've given us over the past 10 years now, but really, you know, how much we've accomplished, and this
Thank
past
you.
year has been, like, just an incredible experience that I'm sure none of us expected to go through, but your work here has been pretty incredible. So,
Thanks.
yeah. Okay. Is there any public comment on this item? Okay, then we'll have a roll call vote.
Dr. Bader.
Yes.
Ms. Bedell.
Yes.
Ms. Brandt.
Yes.
Ms. Concepcion.
Yes.
Dr. Duffy.
Yes.
Mr. Fazzard.
Yes.
Mr. Hutchinson.
Yes.
Mr. Leos.
Yes.
Ms. Zidney.
Yes.
Okay, that item has passed. And just to clarify, we'll be bringing a contract on a future agenda, was the goal of this item. Item C is a motion to delete CIP 1.0301, agriculture production, as shown in attachment 5C.
So moved.
Second.
That has been moved and seconded. Any questions or discussion? Okay. Laurel?
Just a question. It says this will not result in any reduction in student allotment, staffing changes, or teacher furloughs. What I was wondering is if there is a budgetary impact to this.
Amber, I have sort of the
Got the-
details on this. So I'm the board representative to the CTC, and I think I sent out something to all of you right after our meeting to the local advisory committee. This is the course, we've already approved the replacement course, and the replacement course is sort of more biological and life sciences based take on agricultural sciences. So we, since we had to approve the new course first before we deprecated the old course, so this is a motion to deprecate the previous course. So this is sort of a one-for-one substitution, so it won't affect budget or personnel or anything like that, or course enrollments. Okay.
And Jim, this corresponds to our communication with the Department of Education. This is really basically, because this goes along with the reporting that we make to them regarding the content of our curriculum and how it aligns with state mandates.
That's correct, and I'll be given a report later in the committee reports, but the new courses were approved as of May 27th of this year. So in terms of those changes that Dr. Morden made to the lineup and the number of years and the number of hours that students had to be in the classroom, so those were approved on May 27th. And this is one of those things that this was one of those courses that was approved in the sequence for agricultural sciences, and therefore we have to take the previous one out.
Great. Thank you.
Okay. Other questions? Okay, thanks. Is there any public comment on this item? Okay, then we will have a roll call vote.
Ms. Bedell?
Yes.
Ms. Brandt?
Yes.
Ms. Concepcion?
Yes.
Dr. Duffy?
Yes.
Mr. Fazzard?
Yes.
Mr. Hutchinson?
Yes.
Mr. Leos?
Yes.
Ms. Sidney? Dr. Bader?
Yes.
Okay, that item has passed. And item D is a motion to approve the purchase of 2021-2022 stop-loss insurance for employee health care, as shown in attachment 5D.
So moved.
Second.
Okay, that's been moved and seconded. Are there any questions or discussion? Okay. Is there any public comment? Okay, we'll have a roll call vote then.
Ms. Brandt?
Yes.
Ms. Concepcion?
Yes.
Dr. Duffy?
Yes.
Mr. Fazzard?
Yes.
Mr. Hutchinson?
Yes.
Mr. Leos?
Yes.
Ms. Sidney? Dr. Bader?
Yes.
Ms. Bedell?
Yes.
Okay, that item is passed. Item E is a motion to approve the 2021-2022 agreement with Penn State for athletic training student interns, as shown in attachment 5E.
So moved.
Second?
Okay, that's been moved and seconded. Any questions or discussion? Okay, is there any public comment? Okay, we will have a roll call vote then.
Ms. Concepcion?
Yes.
Dr. Duffy?
Yes.
Mr. Fazzard?
Yes.
Mr. Hutchinson?
Yes.
Mr. Leos?
Yes.
Ms. Sidney? Dr. Bader?
Abstain.
Okay, that item has passed.
Hold on, sorry.
I'm sorry.
Ms. Bedell?
Yes.
Ms. Brandt?
Yes.
Sorry.
Sorry.
That's okay.
Item F is a motion to approve the 2021-2022 Penn State College of Education Clinical Experiences Affiliation Agreement for student interns, and this is shown in attachment 5F.
So moved.
Second.
Okay, that's been moved and seconded. Any questions or discussion? Okay, any public comment? Okay, we'll have a roll call vote then.
Dr. Duffy?
Yes.
Mr. Fazzard?
Yes.
Mr. Hutchinson?
Yes.
Mr. Leos?
Yes.
Ms. Sidney? Dr. Bader?
Yes.
Ms. Bedell?
Yes.
Ms. Brandt?
Yes.
Ms. Concepcion?
Yes. Okay, item G is a motion to approve the 2020-2021 payment to the Penn State Psychological Clinic for clinical services, and this is shown in attachment 5G.
So moved.
Second.
Okay, that's been moved and seconded. Are there any questions or discussion?
Just one. As I was going through it, I'm thinking, is this
Mm-hmm.
prospective or is this retroactive? And it sounds like it's payment for services that were provided this year, for this past school year. And so we'll need, and it's essentially an assistantship. So we're essentially, through our payment, we're supporting this person's tuition, and we're also paying a stipend, a 20-hour per week stipend, which makes sense. All these things make sense. This person seems well qualified from the description in the memo. Seems well qualified for what they did, but we'll be anticipating a similar action for next year. I would suppose as well.
Jean, are you still on?
I don't think she is.
I believe that's correct.
Okay.
Yeah, that is correct, Dan. It was, we didn't get billed through Penn State for it. It was a service they were providing throughout the school year.
Great. Okay. The only thing I would appreciate in addition, not in relation to this particular item, but if we could see all in one place, all the various contractual relationships we have agreed to. Now, I could go back through the various agendas and try to track them down. But if those of those who are closer, like perhaps through Jean's department or through Saria's work or through Saria and Jean working together, if we could see them all in one place, I think in terms of just wrapping our minds around the support system that we're creating. And these are all good things. I'm not taking exception to any of them, but it'd be nice to be able to see them all in one place when it comes down to it.
I don't disagree. I don't think it would take much to do that either. You know, as far as our partnership with the psych clinic, which was really to bring in to really, Mike Wolf also helped us out with our teams. They were attending team meetings in buildings, and they've been doing that for quite some time, but they've really stepped up their supports for our building teams. And then obviously the clinical mental health professionals who
Yep.
we're contracting with, as well as the Her Clinic partnership. So there's really three pieces to our external partners as far as mental health goes,
Right.
is what I recall. I don't think I'm missing anything, but I don't think that would take much, Dan, to
That'd be
pull
great.
that together in a recap. Or also the question is, will we be continuing all three of those relationships? Technically, I guess it's 5 relationships,
Yeah.
but the Her Clinic involves many more people than just the person supervising.
Yeah.
So, yeah, we'll check in with Gene and get that.
And some of them
I'll-
are consultative, some of them are direct service. I mean, there are a variety of different pathways, if you will, by which they're providing services, I would
Right.
think.
I'll put that on the future agenda item
Okay.
parking lot
All right.
list.
All right,
I
thank
agree,
you.
that would be helpful.
I think
to
just in
have a
terms of
good picture of
our seeing
big
it, the safety net, what's the mental health? We recognize the need, we've been talking about it. But in terms of looking at the dynamic relationship between those services and the needs of kids, I think would be helpful.
Agreed.
Thank you.
Laurel?
Thanks. This is tag teaming on what Dan asked. So had we approved the concept a year ago, but just never got billed for it? Or did we think that we were not paying, and now they're looking back and saying, no, that was something we wanted to be paid for?
I believe we approved the service previously. I'd have to double check with Gene, but we just did not get billed through Penn State.
But we did, I think I remember, if
Yeah.
it's the one, we discussed it, and that we had originally, a few years ago, not been going to pay, then that picked up, but we did know it was coming.
Correct.
Yes. It was a mistake on their end to not bill.
Okay.
That they should have been billing us throughout the year.
But I definitely second what Dan asked for, because it's valuable to know.
And Dan, I'll put it on our parking lot for CCL
Great.
so that we can,
That'd be great.
it would make
finance.
sense to go
That'd be great.
there as far as what services
You bet.
and why.
That'd be
I
great.
mean, I don't disagree, there's resources involved, but
Right.
as far as should we be providing resources and why. I
And this
think-
is why I think CLC, in my view of it at least, what it serves is understanding the relationship between programs and needs. And I think that this would really be helpful in terms of recognizing the support that the kids and community mental health needs are being met in in these various ways.
Yeah.
Thanks, Bob.
Okay, yes.
So I assume this person gets a vacation, but it does say it's a calendar year. So do they then work throughout the year, including over the summers?
Isn't an assistantship a 9 or 10-month appointment?
That's what I was wondering.
I believe that's, so we're paying for a half-time assistantship, so
Right.
Right.
that's a 9 or 10-month.
Okay, and it's just worded as a year because of the way they word their contracts. It's not that,
Academic year, I guess.
yeah.
Okay. Any other questions on this item? Okay. Any public comment? Okay, we'll have a roll call vote then.
Mr. Fazard?
Yes.
Mr. Hutchinson?
Yes.
Mr. Leos?
Yes.
Ms. Sidney? Dr. Bader?
Yes.
Ms. Bedell?
Yes.
Ms. Brand?
Yes.
Ms. Concepcion?
Yes.
Dr. Duffy?
Yes.
Okay, that item is passed. Item H is a motion to award the high school access improvement project to the low bidder as shown in attachment 5H.
So moved.
Second?
That has been moved and seconded. Any questions or discussion?
I'm delighted that we were able to accomplish this, and particularly being able to use some of the what bond funding that we didn't otherwise need for the project, or is going towards something which was really needed, and that the bids came in at the level that they did, I think really worked out really, really well. So the persistence that Ed gave to this and the support that it received from the business office, I think, in a sense, was paid off, if you will, or rewarded through the bid process, through someone with whom we've worked before, where we're satisfied with their work. So I think it's all good, essentially. I'm glad that we're able to accomplish this.
Agreed. Okay, any other questions? Is there any public comment on this item? Okay, we will have a roll call vote then.
Mr. Hutchinson?
Yes.
Mr. Leos?
Yes.
Ms. Sidney? Yes. Dr. Bader?
Yes.
Ms. Vidal?
Yes.
Ms. Brandt?
Yes.
Ms. Concepcion?
Yes.
Dr. Duffy?
Yes.
Mr. Fazard?
Yes.
Okay, that item has passed. That does mean there's going to be a lot of busy construction at the high school campus this summer then, with O'Brien Lane also under construction as well. Okay, then moving on to information discussion, we'll be looking back at the proposed refinements to the summer health and safety plan as shown in attachment 6A, but we have an updated version at our table here.
So the individual page that you have should be the first page of the document. The paper clipped document utilize pages 2 and 3 with the individual page. It just mainly deals with the fourth bullet.
Right.
Excuse me, the third bullet under indoor. So as you see under the indoor bullets, and they should jibe with the memo and the plan, which is in full further below. I'll just read through those. Masks optional for individuals who are fully vaccinated. Masks recommended for individuals ages 12 and over who are unvaccinated. Masks mandatory for all students below 12 years of age. Masks mandatory for all students and unvaccinated employees in classrooms with individuals who are ineligible for the vaccine due to their age or medical reasons. And no physical distancing requirements for K-12 with the exception during lunch. So that, I believe, reflects our discussion earlier. And the one thing that I didn't share was the feedback from the team for our meetings would be consistent with what we do at the high school level because of the access. Obviously, if we had younger students coming in, that would change the dynamics. It's only when we have guests that we invite or our Boy Scouts, typically do we have younger students. We do have older students on occasion who come in to speak for items, or students that are part of our board representatives. So Matt Ferrari's advice was what you're doing at the high school would be his recommendation for what we should do in our board meetings. So mask optional for our meetings.
So I think I had some concern about the amount of space that we have here in order to be able to provide physical distancing, knowing that there will be potentially unvaccinated people who want to attend our meetings. And my suggestion would be if we could look into meeting at the high school auditorium when we're at the point when if we're going to open up our meetings to public participation in person with members of the public coming to meetings to just have that greater air volume space there for that purpose, to be able to allow for everyone in the audience to be comfortable in terms of safety and for ourselves as well. So, is my suggestion.
And to follow on Amber's thought, we can never anticipate how much, what the interest in participation may be. And there have been some meetings where we've had a full house and people lined up around the back of the room and going outside. It could be, and I'm not predicting that, but that's always possible. So it's nice to be able to, it seems to me, in thinking about this, arranging it for a location that would allow for there to be some space, if you will, for those in attendance who can still physically be present and participate in public comment and so on, but where we may need to have an opportunity for people to spread out a bit.
And I think often when we've had big crowds, a lot of times it's been when we've also invited, groups in, whether student groups or, for various events like the art appreciation. But, there's various times when there are quite a few people here for a particular purpose too, so.
Nick, at the high school campus, we could do obviously Zoom and allow people to see from home, but we wouldn't be live on CNET station, correct?
That's correct. This is the only location in the district where we're live.
So channel 98, we would not be live. That would have to be taped and shown later. Would obviously be live for anybody who logs in on the Zoom account.
But CNET could tape in that location now, and and then they could schedule it for, as well as people, can people,
By their capabilities, I don't know if Abby can speak to that. We can stream to YouTube. Okay, so
oh, that's good.
stream and
Yeah.
recording?
Okay.
That was going to be my question. Is we can
Could we
continue to
do
YouTube stream also.
Mhm.
So
Scott?
You know, one of the other things that we've done, again, this is just the starting point of these, I think, of these conversations. But when we've had high attendance, you know, specifically at this location, actually, I can't remember whether it was here or whether it was down by Memorial Field, you know, we would actually have people out in the hall and have video out in the hall in
Right.
chairs. So, you know, another option might be to have some extended viewing area, let's say, outside of the room, and then have limited public, you know, entrance into the room for public comment and then leave, so that you're still, again, it's, in my mind, it's all needs to be in accordance with CDC and Department of Health guidelines, you know, that if we have a capacity of this room, that we're following those guidelines, you know, et cetera. But I think that's another option. And I don't know whether one's better or worse from that standpoint, but just, you know, I think that we'll have a number of different things to think through as we go through that.
Yeah. Jim?
yeah, I think Scott's suggestion is that of an overflow room here is the difference is that we could live broadcast on, you know, Channel 98 for those people that maybe don't have internet service or what, that would still like to watch it.
Right. But it could still be replayed.
Yeah,
CNET.
sure.
Laurel?
The other difference is that the optics, I guess, in the auditorium are that the board is up on this huge, big stage, whereas we're not here. And I like this better. I'm concerned about that piece.
We certainly could try it, right, and see how it goes. 'Cause
I'm fine with either on a trial basis, absolutely.
And I would also be sensitive just on the staff requirements to make that happen at the high school for a meeting. And I don't know what that would be. I don't know whether that would be a heavy lift, or whether that would be no big deal because of the upgrades and the technology we have there. So I would definitely want to be sensitive, you know, to that as well.
I mean, there's no doubt, I think CNET would need to bring some equipment over. We'd need to get tables set up and all of our microphones and things, so this would all need to be transported over there and reconstructed in that building. Again, Matt Farrar's advice was, what you're doing with your students, you know, would be his recommendation to how we would operate. So we aren't putting hundreds of students together in rooms this summer. We are putting students together in classrooms, and they are indoors at the secondary level, but it's not in that volume. So if we did stay in this location, we would, if we did have a large turnout, to your point, I think that would have to be a protocol we put in place. Otherwise, the high school idea, and to Laura's point, I've been part of, we used to rotate meetings in one of the districts I was in. We would go down in the pit, so to speak, but not the below grade pit, just the, and I think we may have done that in a meeting we held in the North Auditorium back in the day, so that we weren't sitting up on the stage. So,
Yeah, it kind of seems like right now is not, I mean, like Jean kept saying when she was here with us, and what epidemiologists have been saying, right now the cases are low in our area. And so what we do now might be appropriate, and then if things change in the fall with the Delta variant, especially knowing that for J&J it's only 60% effective for the Delta variant. And so at that point, if it's rampant in the community, then it may be a different decision to say, you know what, now we really need to go over to the high school auditorium to get more cubic square feet so that we can have it be safer. So again, just looking at local numbers. I know Jean said it 5 times, but she's just so right on. And knowing what they are now and how low they are, that seems like we can incorporate that into our decision making. And then the trial idea, whoever suggested that just makes sense. Because if something doesn't work, then it doesn't work. But depending on what happens in the fall, with the Delta variant and any other variants that come our way.
Well, if we're going to stay here, then I think we need to, think about what the capacity is for the room and making sure the seating is spread out safely.
Agreed.
I mean, if we're going to use this room, we'd have to go back to our normal table and set up front, because right now we're taking up about 2/3 of the room with our setup. And we could, I think, taking a look at it in the back there to just make sure we're distancing chairs if we stay here. I don't know if there's a consensus on that from the board, if you want to stay or if you'd like to have your July meeting in the high school auditorium, if it's next month. I mean, I think that's the key question. Or we have a special meeting that we're holding for next week. We may have one action item, maybe two.
Well, I think that it would be easier in terms of transition to continue with this space and to test it out as the first step, and then as if needs develop, or if that experience suggests that it's inconvenient for those who can't join us in the room, but take exception to having to observe the meeting from an adjoining room. If that turns out to be problematic, then we can have the option of going to a larger space, I guess. But it'd be easier, I think, systemically for us just to simply try to stay within this space. One of the questions that comes to mind about this is the plan, the health and safety team's perception of things is that we wouldn't be required to have a 6-foot distance management. It'd be more along the lines of 3-foot distance between people in any kind of setting.
For the fall? You're talking for
Do you
the
mean in
fall
the
or the summer?
boardroom?
The boardroom, if we're
Right.
here, yeah.
I mean, it seems prudent to have 6 feet of distance with, we know there's going to be unmasked and unvaccinated people,
Okay.
right?
I mean, I think Matt's point was we're vaccinated, you have access to vaccines, and
Right.
that's why that would be the same as what we're looking to do with the high school,
Okay.
was his take.
To
So-
not require the 6 feet.
But I do think asking him about gatherings, because it's pretty, the CDC's pretty vague around, that they're not encouraging large gatherings, so
Right.
when we were at normal capacity here, maybe we had, 60 seats in the back here, approximately, Nick?
I was thinking it was closer to 75.
Okay, so, and that was no distance at all. I mean, that was edge to edge, almost like, the rows didn't have any spacing at all, so, and we don't have students in classrooms sitting like that.
Right.
So desks are separated, you can walk up and down aisles, and
I mean, I have to think members of the public are going to be a lot more comfortable if there's, like, some, people have gotten used to having a little bit of a personal bubble.
Yeah, right.
So,
Yep.
I also wonder if we just had this thought, if we do move over to the high school, would people be more likely to come and give their input because they feel more comfortable because it is such a large space? I know they can Zoom in, that's there too. I think I can't speak for everyone, but I know for me, meeting in person is much more worthwhile than on Zoom in terms of people making a public comment. So I would be perfectly happy with moving to the high school, just in terms of overall space. And I think people I've really noticed that. There's like an emotional, people are experiencing an emotional response to being near people again, which even if they're vaccinated, it's very interesting. But I just do wonder if people might feel more comfortable in that space.
It may be more
Considering we're
inclusive.
still in the pandemic and the Delta variant's coming, I think 30% right now of cases in the US are Delta. So it might just, I don't know. That's my 2 cents.
yeah, we need to know what people think so that we can make plans. There's no doubt there's a lot more space in the high school auditorium. Everybody,
Absolutely.
And 2 levels, right?
Right. What's the balcony?
I think it's more inclusive of people who might feel more cautious about coming out to
That's what I mean,
a
yeah.
public meeting.
Yeah.
Scott?
Yeah, like I said, I'm just concerned with the impact this is gonna have on the staff to make that happen. And I'd rather see us, if we're gonna do a trial, I'd rather see us do a trial where we currently are and see whether that works. And in my 7 years on the board, there's really a very infrequent number of times when the uninvited public has filled the room. We have filled the room because we have invited people and we can control that. When the public comes of their own volition, that doesn't typically fill the room. It's typically filled with people who we invite or the teachers from the facility that are attending for that meeting or whatever it might be. And I think those are the guests of the board that we have more control over, the spacing out and how that works. So, I mean, I'm not against looking at the high school, but I would be against looking at the high school before we give this space a try and see whether it works or not. I mean, we don't really know what the capacity is of this room. Now, I certainly don't know. Don't know what the limitations would be from the CDC and Department of Health based on their capacity, limitations right now. And to Bob's point of the whole safety plan, what happens on June 28th and what changes from that point forward. So that's my concern, is the burden that we place on the staff with really not much factual information supporting one way or the other. So I would be in favor of trying this first.
Capacity in this room, if we had, just to Matt's advice, we'd probably be between 30, 35 attendees in the back. So if you take Nick's number and you put a foot in between, a couple feet in between each chair, that's what you're looking like in this room. With the July agenda, do you believe there's a chance we would have a lot of people showing up with the fall safety plan on the?
Yeah, not in the summer. If it's gonna happen, somebody said we never know when, that's true. But anything dealing with the safety issues is likely to bring about a lot of interest. And that would be, what, like August,
Well, it'd be
September?
July 19th.
Okay, so it would be July.
Yeah.
Yeah, so then it makes sense to move over there now, I think, because that's when you're gonna see, like Scott said, it's not very often, but if that's when it's happening, then that's when you're gonna see the numbers. So, and it wouldn't be good to have it here and have so many people come that then we said, oh, we said you could come, but actually, we're over capacity, you have to leave. It just seems like the high school makes more sense. We're still in the pandemic.
Is there a reason for the high school versus Mount Nittany Middle School auditorium, which is closer? Just in terms of if you have to, I'm thinking we did a Xerox today, well, that's an outdated term, whatever. Sorry. But, just in case you need to run back for something and that type of thing. It may be a little smaller, but it's bigger than here.
Right. It really, I think I don't know why the high school piece was just size. Nick, do you have a preference from the team standpoint? Would it be easier to be at the middle school? Okay.
I know, it's brand new and nice.
I guess part of my thinking is about being inclusive of people who are not ready to be in a room this size with, as many people as might technically fit in it safely.
How is parking going to be with the construction in that back parking lot at the high school?
Good. Probably might be difficult, right?
I don't know O'Brien Lane's status for mid-July. I mean, I would think, are they just doing a repave?
But we're also doing the access.
With that new curb cuts?
Yeah, but I
Will that
don't,
parking lot be closed for the
I don't
curb
think it
cuts?
affects most of the parking lot. The parking lot's open now while the construction's going on.
But with the curb
It's
cuts?
just only with the,
That's what I was thinking about, the curb cuts.
Yeah, but there's still two parking lots on that side of the street. There's the Delta and the other. So, and those are both very large parking lots. I
Yeah.
can't imagine both would be closed.
Right.
yeah,
But we're talking the high school auditorium, right?
Right.
Yeah, they'd have to
On the
cross
other-
the street.
yeah.
I'm really comfortable with the staff making that, evaluating how difficult it is for
Yeah,
them.
we can check in with Ed and see if there's any problems. But depending where I don't think everyone's weighed in yet on, do you want to see the July meeting here or at the high school? Nick, do you want to vote?
We have a meeting next week.
We do. So we could think about it between now and
I would love to
next
hear
week.
from the staff, to Laurel's point. I'd love to hear from the staff to see, maybe my concept of the heavy lift is not warranted, and maybe it is really warranted. I have no idea.
I don't know what kind of furniture we have over there. The technology, the sound system and things, Nick, a day? I mean, you want to just give us a quick thumbnail?
To your point about the heavy lift, there is about an hour and a half of setup and tear down each time we were doing other things in this room. So there is a little bit of a lift, and moving that to another building would be a little bit more than that. I don't think it's impossible to allow the community to participate. I think that's a worthwhile endeavor, personally. As far as a preference from the technology standpoint, I don't really see one way or another that there's an advantage to either space. I think that it's doable anywhere you'd like to do it.
Well, the idea of potentially turning people away is really undesirable to me. And we don't know how people will feel about anything we've got on our agenda. So I personally would err on the side of not turning people away, and having people feel as comfortable as a wide swath as possible of people feeling comfortable in the room with us. So if it's not too much, I think I would be supportive of that, of moving it to a larger space as well.
Same
Yeah.
here,
Yeah.
is moving it to the high school if feasible.
Yeah.
Okay.
If I think back to the old administration building, old central office, and having attended some meetings where people were out in the hallway, when you were still 30 or 40 feet away from the entrance to the boardroom.
Yep.
It was really, it was inconvenient at the least in terms of people's experience of participating and knowing what's going on. It'd be much better to all be in the same room together. A very much larger room.
Gretchen?
I support moving over to the high school right now, at least. Yeah, definitely.
David?
Well, it seems like the consensus is to go to the high school, although, and I was leaning that way myself, but I think it's kind of rare that we're going to need that kind of capacity. So I think it may not be as hard to anticipate those meetings when we're likely to have more interest in attendance, and on a case-by-case basis, if we get a feel for it, that we can move it there. But if the group is feeling the high school is the way to go, I don't know, it just seems there's a trade-off between having the capacity that Amber's talking about and also feeling like kind of lost in the room, So there's a certain value to having the closeness, that you're part of the meeting, that, the audience that's sitting. So I kind of lean to here if we think it's feasible, but then consider going to the high school, and we anticipate that might be an issue.
Okay. Laurel?
I really don't feel strongly, so if the consensus is the high school, fine, except that I do think we need to hear from the staff if it's a problem when they actually try to scope it out. Well, when then actually, so if they feel after they think about it, instead of being put on the spot now, they should come back to us. And
Well,
Okay.
because we also talked about the overflow room here too, and so we have to add that to the capacity here.
Justin, he weighed in with me. I believe he is on the Zoom. I know Nick has been really instrumental in managing this room, so you got the, firsthand update from Nick. So, Justin, is there anything do you have anything to add? I don't know if it's.
No, I think if Nick feels comfortable either way, then that's fine. I do know we could also do the overflow in the library, so I think either option's probably viable as long as we're not obviously switching back and forth. So if we make a selection, that would be the main thing we would just want.
Well, in terms of switching back and forth, I mean, I have to imagine if we're going to do this, it's not going to be for indefinitely. It would be for
Right. Yeah. I was more meaning that if to use the high school for certain meetings, but then PV for others. So that if we were going to switch to the high school, that would be the meeting format until we were to move back full time to PV. Does Does that make sense?
It does. Would there be any anticipation that our meetings could conflict with something else that's happening on a Monday night in the auditorium that would be a student use of that space?
We haven't looked out at the calendar, but yes, I'm sure there would be some conflicts we would have to resolve if we were over there twice a month through the
Okay.
fall, for sure.
That's something to think about too, then.
We can
Yeah.
take a look at that, but I think if through agenda planning, checking in with the board, we,
Mhm.
you know,
Oh, Amy, I see your hand up.
Yeah, hold on one sec. Sorry. Yeah, I was just going to concur. I would think that based on what Justin said, if we were to head over to the high school, we'd probably want to pick a finite time, maybe up until we're close to making all the decisions in regards to the safety plan and such, going into the new school year, because we know that that is a topic that, you know, may engage a lot of community. So yeah, that was the only point I was going to make, that we potentially choose it as a temporary choice for potentially the couple summer meetings leading up into the school year, and then if we want to be prepared for an overflow room in the fall, that seems like the way to go.
And the big takeaway, I mean, is that we're moving back towards in-person participation for
The July meeting.
for the general public.
Mhm.
In any case, no matter where it is.
I think so, yeah. Okay, so we'll revisit this on next Monday, I guess. then,
so,
if there's,
so right now, we have direction for the July meeting in the high school auditorium,
I think that's
right?
it seemed like
Or-
that was the way the numbers went.
For next meeting, we'll stay with the same format as
Mhm.
is.
Yes.
Okay. And then, because if we were going to change next meeting to be in person here, then I'd want to reconsider July, but, okay, so that we're not reconfiguring this room multiple times in this window. I do think to the request around the summer safety plan, so that, would the board be willing to support that to be enacted in the summer, or not?
Oh, do you mean?
It's
to
not an action item on your agenda. On the memo, we did request
Oh.
you to consider action on that, and I'm just asking you for your consideration on
If
that.
anyone would like to make a motion, if anyone would like to move that this be moved to action, I think is the question.
I would like to move the updated health and safety plan to action for this evening.
And we'll change the electronic file on your site here. Lynn, the Google Doc is correct. Thanks.
Okay.
Let me make sure I have it.
Is there a second? Okay,
Second.
it's been moved and seconded. Laurel?
I just always have a concern, this is a touchy topic, and I don't know why it wasn't information. I mean, I can see the reason to do it tonight. I just wish it had been under information so that if there were people who had real concerns, they would know, because even I hadn't picked up that it was, that it would be moved to an action item. I mean, once I read it over again, I could see that that's how the first paragraph could be interpreted, but I wasn't clear about it, so I'm wondering why it wasn't put on for action.
Okay, because there's been times where individuals on the board have said, you've put this on here as an action item without a discussion.
I
I
understand.
think you've been one of those people.
Yeah, oh, I agree, and I've got another one coming.
So
No,
I was
it's more
be-
but if you're intending to ask for it to move to action,
You don't
is my
have to
only
move it to
concern.
action.
It's
I
an
mean, that's,
ask,
I
it's
asked
not
for the
a-
consideration. If you do, we'll enact this plan. If you don't, we won't. Sorry, I wish we would have now.
Well,
Sorry.
just as part of this discussion, my impression from the memo was that we would likely be asked to move it to action based on
Says that in the
the
first
discussion
paragraph,
this evening. Yeah.
that
Mhm.
they would request that.
Right.
But-
Right.
Yeah, we erred on the side of putting it on info, Laurel, and have a upfront ask versus put it on as action and not having spoken about it. But either way, it yeah.
Well, and Laurel, I mean, that just made me think of, because it is in the, was it the first paragraph?
Yeah.
So it was available to the to the community to see this might be voted on tonight, and so at least there was that. But I see, but I mean, point taken with what you said, but I think, wouldn't this mean that then this could like affect people tomorrow, which would be awesome?
Well, it says effective June 28th.
Yeah.
Oh,
after the-
June 28th,
After the
okay.
governor's change, because we're still consistent with the state mandate as a school district. Yeah.
Okay, so it's been moved and seconded to move to action. Then do we need to,
You need to
Oh.
vote on that.
we need to vote on moving to action? Okay. Does that need to be a roll call vote to move it to action? Okay, so we will take a roll call vote on that motion.
Mr. Leos?
No.
Ms. Sidney? Dr. Bader?
Yes.
Ms. Bedell?
Yes.
Ms. Brandt?
Yes.
Ms. Concepcion?
Yes.
Dr. Duffy?
Yes.
Mr. Fazzard?
Yes.
Mr. Hutchinson?
Yes.
Okay.
Okay, so we had 2 noes. Is the policy that if we have 2 noes, that we cannot move it to action, or is it
No.
1 no?
I thought it was a 2/3 now. So 6 is sufficient,
Is
isn't
it?
it? Or,
I thought we
oh,
put it at 2 people,
okay.
but I can't remember if 2 people could,
It was definitely more than one.
I remember that.
I do know that.
Math major.
This is not until the 28th.
And we have a
Sorry, I'm
special
gonna-
meeting on the 28th.
I'm just going to look up if the policy's been updated since, I know we just recently.
Right.
March
Sorry, one moment.
2?
With 2 people, you can or cannot move to action.
Such move is objected to by 2 or more board members who are present.
Okay, so we could not move it to action then?
Okay.
Okay. So then this will be on as an action item for the June 28th meeting.
And it would go into effect on the 28th.
Right.
29th.
Or, yeah, okay. Yeah, good point. Good point.
Oh, and you know, I'm sorry, I should have taken public comment before we voted on whether or not to move it to action. And I see someone has their hand raised. Peter, would you like, Peter Buck, I see your hand raised. Would you like to speak? If you'd like to unmute yourself and introduce yourself, and then you would have 2 minutes.
Yeah, thank you very much. Can you hear me?
Yes, we can hear you.
Yeah, thank you very much for taking my comment. My comment is now a little bit moot because of the previous vote and the rule that stands in place.
Do we need
I
to
just
go
think
back?
that procedurally, it's most helpful for the public if an item is actually an action item or not an action item, because it's confusing for citizens to engage with a board if you don't know what is actually going to happen. And so I think some of that flip-flopping, which I understand given the nature of this this issue, that it can move around very quickly, but I just think that it should have been in the agenda as an action item or not. And those who set the agenda should probably have lived with that decision. Thank you very much.
Thank you for your comment. Okay. Okay, so I think at this point we will take, unless there's anyone else that wanted to make a comment that didn't get a chance to. Okay. All right. At this point, I think we should take a 5-minute break and then come back for the next item. So we will take a 5-minute break. Thanks. Okay, I'll go ahead and call the meeting back to order. We're moving on to item 6B, student learning. We'll be looking at the fall planning update, and you can find this on your agendas at attachment 6B. And I'll turn this over to Dr. O'Donnell for this discussion.
Thank you. I'm just getting my file out. In the update, what we wanted to be able to do is share where we were with the fall planning and in regard to the different educational models. And for our staffing decisions, we want to make sure that we're clear with how we're making decisions. Obviously, when you look at the elementary options, and we were clear, we wanted to see how enrollment worked out, because remote classrooms, this past year, we staffed in a similar, not identical, but pretty close to identical to how we staffed in-person classrooms. So that's why we referred to the board policy, which has guidelines around class sizes. So Vernon Will are with us here, and because elementary was a little bit more complex, Vernon, are you okay to share? Do you have your document open there?
I'm opening it now.
An update there in regard to where, if the numbers stay as is, where we'd basically be running virtual academy with some synchronous remote opportunities for students in almost all grade levels, except 2, I believe. But do you want to give an overview on the elementary side of this,
Yep.
Vern? Thank you.
Absolutely. And just to kind of recap some of the numbers that you have in front of you in the document, we had about 26, a little over 26, almost 2,700 respondents. Can you guys hear me okay? 2,700 respondents to the family selection survey who were elementary families. And of those, 96% chose the in-person option for fall. And you can see the breakdown for Virtual Academy full year. There were about 20 students, which represented less than 1%. And Virtual Academy, until the vaccine, remote learning for the entire year were both under 0.5%, so less than 10 respondents in each of those categories. And then our remote learning until the vaccine was our largest subgroup at 67, which represented 2.6% of the respondents. And Dr. O'Donnell did mention the 22 students or 22 families in our current second grade, which would be rising third graders, who requested a remote learning experience, and that does fall within our class size guidelines. Our smallest classes at the elementary level generally never dip below 16.3, even when we get to the threshold and add an additional teacher. So all the other requests were well under that. So we did feel comfortable offering that district-wide remote learning for those 22 third grade students until the vaccine becomes available. Any questions regarding elementary?
Laurel?
Yeah, thanks, Vern. What percentage was this response rate?
We generally have around 2,850 students at the elementary level, so it was pretty high response rate.
Yeah, very high.
I don't have the exact percentage.
Yeah,
it
but
was
it's very
relatively
high is what.
Yes, ma'am.
So I am still curious about, given that of the bottom 4 options, 2.6 were remote learning until vaccine. I understand all the challenges with staffing and all, but I'm a little concerned about just basically leaving that out for those people. The virtual academy, to me, as I think people know, I've thought for a long time we should have, just because there are cyber charters out there, and it allows us to compete even if we didn't have a pandemic. But I'm concerned about not even considering the remote learning until vaccine as an option, even if it were multi-age classrooms, because I understand the issue about class size.
Well, our curriculum's not, as far as if we're going to teach direct instruction, when we had multi-aged rooms, we used unit-based curriculum over 2 grade levels, so that students weren't being taught the same curriculum 2 years in a row. So I don't think multi-age would be the solution to give a synchronous remote experience to a faculty member if the board chooses to override the guidelines of the policy, right now, Vern, I believe third grade is the only grade
Correct.
that we're running.
Correct.
If there's other grade levels that you want to staff for 11 students to have a teacher, you know, you can approve those. But right now, that's what, you know, 11, 12, 16, if you want to approve staffing for those, the 15, excuse me, the challenge would be, would you allow then for those small classes, are you going to, because then you're trying to find a professional that you're going to tell this is done at some point, potentially very early on. And then the remote full year families, are you going to allow them? What are you going to do for them? I assume they would go to the VA, right?
Would, in third grade, the two families that are opting for remote full year, it probably doesn't make sense to put them in the remote until vaccine classroom if that classroom's going to dissolve.
Right, that would be extremely disruptive with a transition, obviously, shortly in the year.
So it doesn't make sense to add these two to get cumulative numbers then.
I don't think so.
I do like the idea of the virtual academy with some daily synchronous learning. I think that's a real positive step, you know, and that'll help ease the transition. You know, if next year they opt to be in person, that'll ease the transition into the, you know, in person, knowing teachers, knowing some of their classmates. So I think that's a great idea.
And depending on how, oh, sorry, Scott, go ahead.
No, I'm sorry. Piggybacking on what Jim said, I guess one of the confusions I have, so if I remember correctly, one of the challenges that the elementary teachers had early on in the fall was when they were teaching in class and remote at the same time. So is that what we're saying will happen with what Jim said as the virtual academy with the asynchronous, or with the synchronous, you know, contact, or?
No. We will have a dedicated virtual academy teacher who will be providing those asynchronous or synchronous, learning opportunities. And Jim, just so you're aware, we did currently in our virtual academy option provide those synchronous learning opportunities throughout the course of this year. So that would be a continuation into next year.
But that was a change from 2 years ago, from pre-pandemic, correct?
Correct.
So we did not provide synchronous opportunities for virtual academy prior to the pandemic.
Yeah, we had virtually no virtual academy. Sorry about that. we had almost no virtual academy for elementary pre-pandemic. That just didn't exist. So this is obviously new because of the pandemic.
And so I guess my question really goes to, from a staffing and a budgetary standpoint, you know, do the selections that people make have a significant impact on, I'm just talking about the virtual academy, on the staffing requirements for the virtual academy in providing synchronous opportunities?
I think when we get to a certain point, it would. I would say with where our selections are right now, no.
Okay.
We did have caseloads as high as 40 to 45 students per teacher. We had almost 200 students and 5 teachers, and there was a lot of multi-grade within that. So teachers were doing a lot of breakouts with individual with groups of students in grade levels, a lot of morning meetings, a lot of check-in times, some remediation and intervention. And I think when those caseload numbers do creep up, it does become more challenging to meet all those needs.
Okay. And then the other question I had was, so one of the challenges that we see with the number of buildings that we have is if you took 22 kids from one building, that's a really easy kind of decision. But if you take 2 from here and 5 from here, you know, you're not really changing the class size in one building that lets you, you know, reduce a section or reduce a class, and you're adding a class over here. So I'm just trying to get a feel for whether that 22 is truly spread across the district, or is it concentrated? And you don't have to tell me a building, but, you know, I'm assuming we're at a point where we're not going to be able to reduce a class in a facility, and this will be an add. from that standpoint?
I would say there are about 10 students in that 22 that are from one grade level in
Okay.
one particular building. However, those 10 students, that really does not do a lot in reducing. I'd have to look at the numbers in that grade level currently.
I'm just curious.
But even 67, Scott, to your point, the 67 that we have down in remote, when we take those from all 8 elementary buildings, the impact that has on class size is pretty minimal.
Right, okay.
Yeah.
And those students would need to have a classroom to go back into. If they're saying
Correct.
they're remote until vaccine, you couldn't go down, if you went
That-
down a classroom
point.
somewhere, then you'd,
Because once the vaccine is out, they would go back. Great
Good,
point.
that's
That
a
was
really
the
good point.
that was the main reason
Nope, I
we
get
needed
that.
now to ask was to make sure we had space, because how Vernon, the elementary principals, do the staffing assignments, it's based on numbers for each of those buildings in those rooms, and in that one example with the 10 students, that's accounted for because of this survey.
Yeah, that's
so
a great point, yeah, thanks.
Really good point.
I have a question.
Lori.
So what happens to the remote learning teacher of the 22 once kids are back?
They would be a predictable term or somewhat predictable. We don't
Okay.
know. And
Okay.
that role would go away. So
Okay.
these would be temporary. And they wouldn't be our faculty, our contracted faculty, because we're not doing a hybrid model for these. They're in person. So I just want to make clear, because that's another aspect. When Vern said synchronous with the remote experiences, but also the VA experiences, those are synchronous with a teacher, but not the teacher that these until vaccine categories would be moving to. It's a different teacher.
Yeah, I want to be clear, there's no model for hybrid instruction
Right.
for this fall. And so I just want to be careful, if I misspoke earlier
No.
with
No.
mixing
I
up
don't think so.
synchronous and asynchronous. I just want you to hear, we don't have any hybrid instruction planned for the fall.
Right. You were good. I wasn't sure if what Scott was asking was getting at that or not. I just wanted to touch
And
on it.
actually, what threw me on that was the one sentence about students who opted for full year learning from home will include asynchronous learning options with their teacher. But it's with their virtual academy
Yeah.
teacher, not with their
That's a
classroom
good point.
teacher.
Yeah,
That was kind of what hung me up on
Yeah.
that.
We can make an edit.
Yep.
Yeah, we need to be clear about that.
Yeah.
We've been clear with.
Scott, you weren't the only person who read it that way.
okay.
Could I ask one more question, Amber? So for families who would like to be remote, but for whom there won't be a remote classroom, they still have the opportunity, so they will have to choose basically between in-school instruction or if they want to do a virtual academy. So that's what
That's correct.
to be clear. Okay,
Right.
great.
And there'll be a teacher assigned to those students. It wouldn't be just to that one grade level. The teacher would have other grade level responsibilities, but because of the virtual academies, asynchronous curricular experiences that are also part of it, it allows the teacher to manage more students.
So virtual academy until the vaccine is one of the options that would be available. And virtual academy full year is another option that would be available. And in person. So they wouldn't have to do virtual academy full year. They could,
Correct.
okay.
Could they do virtual academy and then, for whatever reason they want to go back to in-person, there'd be room?
We'd have to evaluate that on a
Case by case.
case-by-case basis. Obviously, we'd want to try to accommodate as much as we can in that area to.
Yeah,
but-
the reason I ask is because I wonder if there's families who want to wait until the vaccine to go in person, but they're going to then wonder, do I have the choice between virtual academy and remote with a SCASD teacher, or do I have to go with so they're guaranteed in person after the vaccine if they choose the remote option, and they may or may not be able to go if they choose in person after the vaccine if they choose virtual academy. Is that correct?
Well, no, go ahead.
No, go ahead. I don't
They
wanna-
both had, I just want to clarify, because they could have selected to learn from home until the vaccine. So learning from home until they get the vaccine, whether it's VA or remote, no matter.
the reason we asked that, so we have those capacity in rooms. For the small number that selected VA, Virtual Academy, for the entire year, there's also a small number for remote for the entire year. So if they want to learn from home for the whole year and they change their mind, would we have space? Is that the key question you were asking? I think with the numbers that we're seeing here, we probably would in their home building. But we haven't done that analysis. But just because of how small those numbers are, I think we would. And like Vern said, we sure would want to accommodate those students because there's no question we believe we can be more responsive in person to those students.
So just to be sure I'm understanding completely, so families who have chosen, if the options are in-person, virtual full year, and virtual until vaccine, if they choose virtual until vaccine, they are guaranteed a spot in one of our classrooms when they're ready to come back.
In their home school.
Okay.
Yep.
But if they've chosen virtual full year, there's some caveat that
right now we're,
It
just
looks like
eyeballing it. They're really small, but there could be a scenario there where they might have to be an optional assignment to another building if we're over on capacity in classrooms.
And I'll use that example of the 10 students from the one particular school. 10 students coming back into a grade level can be pretty significant, and the impact there might be put us well over class size. So that's something we just have to consider and be upfront with families that when they make these selections that is a possibility. And I think we've shared that with families.
But if they've chosen remote until vaccine, aren't they going to assume that there's a spot?
Oh yeah, they're covered.
They're
Yeah,
covered.
yeah.
I'm referring to the
So-
full year. If a family from full year wanted to come back, that would be a little bit different.
I see.
And right now, we told families we would reopen the survey this month. And the timing is the end of this month. We have a big changeover in the system, but because then in early July, we'll commit to staffing. We'll give that one more window and then commit to staffing of our K-5 classrooms, as well as what we need to do for the virtual academy and any remote classrooms. So right now, we're seeing one classroom for remote, correct?
Yep, third grade.
And we'll reopen the window here shortly, and I think it's open for about a week or so. We'll send out a series of communications to parents, and then
So these numbers could potentially change then?
sure. I mean, they could change. We know that we wanted to get the ask in before the summer because, emails monitored a little less at the end of June. The reason we picked the end of June is we have a massive student information system changeover, combined with we want to staff and, prepare for this fall. Last year, some of the programming getting up and running, including the VA Virtual Academy, was really difficult. And we wish we would have had more time because we would have done better. So we're just trying to, be prepared. And obviously, we have a lot of transitions in the district with people as well that we have to work through too. So,
Laurel?
Yeah, I do really appreciate the transparency of seeing the numbers. And my question is, when you go back out this next week for that window, what will all the options still be on there, or will it just be the options we're discussing based on the initial numbers?
I mean, for K-5, we're not in a, right now, I think the options are still there. We're not making any edits in the system. So,
Well, is
that what you mean?
Yeah, I guess I would actually prefer to see just the options that we're thinking of doing. We can always have a check mark if you still want to stick to your original, but
Well,
I'm interested how that would.
So, for example, if the fourth grade got a handful more kids in the remote until vaccine, then, and.
Oh, I see what you're saying.
Some people
Okay.
some people, as part of our district team, we weren't interested in the remote option, but the reality there, if the numbers support it, we believe that's, depending on the family situation, best for the student. Some families, the parents, in learning from home, don't have the ability to guide their child. So that's why we put the remote out in the elementary grades.
I guess I'm just asking that there be a thing, like a second, if this is not available, which would you choose? That's what I was wondering, and that
Oh,
might help
okay.
you. So
Sure.
we've
I
got it
mean-
out there, but if it's not available based on numbers, and they already know that there's a good chance it won't be, except for that one grade, then what,
Oh, because their second
Well,
choice might be in person and not virtual academy.
it might be.
So maybe they need to
Interesting,
rank their
yeah.
choice.
I mean,
So that's,
think it
that's all I was
depends-
asking.
Yeah.
Yeah,
I-
to have a second choice.
Well,
If-
or, I mean, we may not be able to hold them to it, but it would help with your planning, with our planning, I think, to know where that was
I
headed.
mean, they need to know it's likely that that remote option won't be there,
Right.
so they need to select between VA and, right now, our thinking was they would immediately be told they'd be shifted to virtual academy. Now, if it's until the vaccine and they say they want to come in, it's not a problem because we've already allocated to have them in. So if it's in the until vaccine categories, it's really not a problem to even change later on with a phone call to the principal in August, because that student's accounted for.
And then I just had one more thing, which is more of a general comment, is that I hope somewhere in the background, we are doing some planning for if we need to make dramatic shifts during the year, because we've had to do it once before. I don't want it any more than anyone else does, but
Right now, it's either we're.
oh, the energy needs to be on next
full
year,
remote.
absolutely.
So,
Yeah,
I don't
no, I
think
agree.
we want to have the half and half model. And the reason was, I think we struggled trying to support our teachers when we fragmented them. And we did it in large part because of the immunocompromised students who couldn't come in. And we wanted to make sure that we gave them access to our faculty and our curriculum. In that decision, we really overloaded faculty to a point where they struggled to do well with both groups. And so that's what we want to avoid, that challenge in front of our faculty. And we think we can better deliver a more quality experience.
Yeah, I wasn't thinking of hybrid in any case at all that I could imagine.
So, thanks, I appreciate that. 'Cause
I know, I really, no,
That's not Plan B.
no.
Dan, did you have your hand
No,
raised?
yeah, just in relation to the hybrid, we learned our lesson, to put it simply. The only thing I was going to mention is that one of the elements from the past year that could substantially be different may be the requirements in terms of the health and safety plan that are called for in response to the Department of Health and other guidance that were given this summer. Because some of the requirements for mitigation and so on kind of limited our capacity at the elementary level and in other places as well. So I think when we see those recommendations, that'll give us a better understanding of our freedom to absorb, in a sense, students back into our programs, or manage them without having to deal so much with the requirements for distancing, let's say. So I'm just thinking about this in terms of the interplay of some of the mitigation we've been required to do this year versus what we may be responsible to implement in the coming year.
Scott?
Sorry, just a couple follow-ups. Amber, you had asked a question about people coming back after the vaccine was available. Is there going to be a time frame that will be attached to that? And I mean, in my opinion, there needs to be a time frame, but it has to be pretty wide because we don't really know exactly what the accessibility will be. But we also can't have it open-ended where somebody could come back theoretically in 4-ish weeks and somebody else could come back in 4-ish months. So there'll need to be some parameters around that. I don't presume to know what those should be. So that would just be a question or comment there. And then kind of, I think along the lines of where I took Laurel's question to be going, we ended up with 5 scenarios, I believe, of which 2 of them really weren't valid scenarios. So we really come down to 3-ish. So there's obviously in person. And my question is, it would appear that we're going to have virtual or remote full year, but not both. Or at least that would be my proposal, that if we're going to have a full year option, it's either virtual or it's remote, meaning, again, whether there's synchronous assistance, or not from that standpoint. And then similarly, that it's either virtual or remote until vaccine, but not both. And my sense would be that people filled out the survey based on the information that they had at the time, and now there is additional information, and we may find that people hearing that they can do this but can't do that may actually, change their approach because now they have more, more information. But I would be more in the camp of trying to shorten the 5 options down to 3, because those are really kind of the only 3 at this time that we're going to offer, if that makes sense. Right? 'Cause
Yeah, I guess I would, speak to that and just say that the 3 options that we have, just to add some clarity, are the in-school option.
Right.
Then we have the virtual academy option that's a full year option. And then there's no remote option for the full year other than that one class of 22 rising 3rd graders for this coming year. And so those were the options that have kind of been narrowed as a part of the survey.
We had remote for the full year. You're suggesting taking that off, because I'd said
That's what we had
didn't change
discussed.
it. Okay.
Yeah.
Okay.
Yep.
So
Of taking
remote
that off
until
and giving families-
vaccine would
There's
still be
4
an
options.
editable, but if the numbers don't trigger the class size, then it would only be that one grade.
Correct.
Or they would go virtual academy. then.
Correct.
That would be their option.
They'd have to go VA until vaccine or
in
come
person.
Right. But the VA will have synchronous support from a teacher.
Right.
For the full year.
Correct.
It will. I was talking about until the vaccine shifts.
Yeah,
'Cause that's where there's
the
bigger
VA
numbers.
will have a dedicated virtual academy teacher who will work with those that all students, those, how many do we have? 20 students that are assigned for the full year. There will be a dedicated SCASD teacher who will be working with them. There will be a lot of asynchronous work as part of that, but there will also be synchronous activities planned by that teacher to interface with those students, whether it's through intervention supports, small group activities, morning meetings, and those types of activities.
So I guess my question is, do we want K-5 to have an asynchronous, even with support option? I get it at the high school. Those are high school, middle school. Those are older kids.
Yeah, if I could add some clarity, Scott, the way we've structured it this year and the way we intend to structure it for this coming year is those synchronous opportunities were optional for families and students to exercise. They weren't required. If students chose to attend the morning meetings and families wanted that for their children, then they could do that. If they chose not to do that, then they could pursue solely the asynchronous opportunities through the virtual academy. And I would anticipate we would continue to offer that same structure for this year. So there is that option for families who only want asynchronous opportunities. They can have that in the virtual academy option.
Laura?
Sorry I wasn't as clear on that.
No, there's a lot of variance in how this is interpreted, so that's why I wanted to try to get clarity. Thank you.
Sorry, I was just checking if this went to only people who are in district this year, but I think we had, or did it go to people who we know, say, switched to homeschool or something like that?
We did have a process through registration, and Justin Hetrick and our tech team really helped us with this as well, to reach out to families who are registered with us but aren't currently in our student information system. And a lot of those numbers were also new kindergarten registrants, so they've all been included in our numbers.
Thanks.
Okay. All right.
Because our kindergarten numbers are much smaller than we anticipated, our next outreach is we're gonna try to do something to get to the younger families to make sure that we're not gonna see a late summer surge that we missed. So they're about
we're about 120 down, typically from where we are with the kindergarten cohort currently. And some of that may be, that we have some suspicion, it may be some families are just still waiting to see what we're going to do. And you know, like we had this year, we had some families wait to register to see what we were doing, so we could see that happening again. Not totally sure on that, but that's
And with
sufficient.
the mandatory age being 8 still, we, you know, they're not required to register their children. So some people may just be holding their children out for another year. We didn't have Will go. We had 2 options. Will, would you give an overview and see if there's any questions for secondary?
Just shows how simpler we are compared to elementary. Bob alluded to it earlier. The hybrid learning at the secondary level was just a huge ask for our teachers this past year. So we were committed to not offering that again. So we only had two options, well, 3 options. We had the in-school learning, and then we had the virtual academy for a full year, virtual academy until a vaccine. And you can see the numbers here. I mean, overwhelmingly, 98.7% of our families at the secondary level have selected the in-school learning for next year. You know, we were prepared, if necessary, if we would have had a higher number of virtual academy selections to look at some PTS roles to fill it like we did last year. I think we were close to 200 students in virtual academy, but our numbers are much lower this year, so we're not looking to add staff for that. We're looking to either designate a section for a teacher to teach a virtual academy course, or a term that we like to use are one-offs, where we compensate our staff to teach additional kids through virtual academy. So at this point, unless the numbers change, we're not looking at any additional staffing at secondary for the virtual academy.
Any questions of Will? Okay.
Seems pretty clear.
It's a lot simpler.
Obviously, a much better job of explaining.
And whatever that email was, I just keep doing it.
Okay.
So that's the direction we'll give an update following the closing of the next window, and keep you posted and go from there. I know that some of the questions that I've received from parents are asking for a nailed down health and safety plan, and that'll really come in July. If we're able to get a draft together in the near future, I mean, we basically would mirror where we are now because of what we know, but we believe at the end of the month we're going to see some things change. You know, so if people are unsure and they want to, you know, we still have the option of, until the vaccine for those younger students, that would be, you know, a safe play by those parents, and then they could obviously transition, because we'll have the space and the staffing for their child in our classrooms.
Makes sense. Okay, thank you so much.
Thanks, guys.
Okay, so the next item, we have the board committee meeting schedule. We have Culture, Climate, and Learning Committee meeting at 10:30 on the 23rd, and policy at 11:30 on the 30th. So then we'll be moving on to board reports. Dan, the Central Intermediate Unit.
The IU board meeting is scheduled for this coming Thursday. And I believe I reported on the last IU report, included a description of the contents of the previous IU board meeting. But one of the things that's important to mention is that we're continuing to work on additional options for our facilities. And as I mentioned before, we had a roof collapse at one of our 2 main training facilities during the winter, and we're working to find a replacement for that facility in the Clearfield County area. And it's a stepwise process, like anything involving real estate. It's something you do based on opportunity and based on the market. And so we're continuing to work on that. And when I have more information, we have more information, we'll be able to share that.
Okay, NSBA, PSBA, David?
Sure, we covered a lot of it earlier, but just a reminder that if you want to submit anything for the delegate assembly, the deadline, I believe, is the third week of July.
Okay. Are some of the issues, do you know whether some of the issues that have been significant in the legislature right now are probably already covered by PSBA?
Right. That's
Platform.
correct. That's right, yeah.
And do individuals propose those, or do they have to be proposed by the school board?
They're proposed by a school board, that's correct.
Okay.
Yeah.
All right.
So we need to make a collective decision on that.
So I think I told some of you that I'm thinking about proposing one regarding the use of COVID funds, federal COVID funds, to do some abatement on property taxes for commercial properties. So I'll write that up, and so that a short-term problem doesn't become a long-term budget deficit as a result of them reassessing businesses because of the last 2 years. So I'll write that up, and so it'll be more coherent when I write it up. But
So it would be an either or. So if they took the abatement, they could not then ask for a reassessment.
that's correct. Yeah.
And the abatement would be a defined period, 1 year, 2 years, whatever,
Yeah.
versus the perpetuality of a reassessment.
That's correct. Yeah. And so it would be something like 75% or 85% of their tax bill, with an agreement that they won't apply to get reassessed. So, yeah.
I think I understand, yeah. So David, I'm sorry, when would we need to have that into them? Since we actually have a hot issue here?
Yeah, I was just looking for that.
Right.
Hang on one moment, I'm sorry. Oh, it's not on here, I'm sorry. The number that's in my head is July 23rd, but I'll get to the board about that. I'll let Jim know for sure. So.
Okay, so we can, to get on an agenda if we're going to move forward with that discussion.
May 21st to July 23rd.
Okay. Great. Okay, Scott, the Ed Foundation report?
Yeah, so there are just ongoing conversations relative to the MOU. I think we have meetings on Wednesday to discuss, some proposed revisions, and I believe that is intended to be on the agenda for the special meeting.
Right.
Correct?
Okay. Citizens Advisory Committee reports. There's not been, I'm on athletics, there's not been a meeting since our last report on that. Has there been a facilities meeting? I don't think there has, right? Finance? Okay. School health and safety? No. Technology?
No.
Okay. Okay, so that brings us to public comment.
Can I
I'm sorry.
so I was going to do the local advisory committee for the CTC.
Yeah, we should get that
report.
on the agenda as a running committee, probably.
Oh, okay.
Yeah.
Yeah, so we met on June 9th, and there was a couple things. We already talked about the program approvals that we did. They all got approved by the Pennsylvania Department of Education as of May 27th, and that's why we needed to get rid of the one ag program, so that because it was replaced by one that we had approved. So all 9 programs are approved with the schedule and sequencing that we approved at our May meeting, and Dr. Morton is very grateful for the work that the school board did with regard to that, although he did most of it. We did receive a NOCTI waiver. NOCTI are the exams at the end of the sort of the capstone exams at the end of a CTC program. But as a result, I think there was some concern when we approved the waiver, both at the board level and at the local advisory committee level, that some of the students would be missing out on an important credential. And so what Dr. Morton did was he organized each program, provided some local assessments, and also in addition, where there was a credential that could be approved locally by, you know, for instance, like a heating and refrigeration credential, is that was done. So that the students aren't totally left out of that credential. They receive some local approvals, you know, to put on their resumes. And I think that was a really
addresses some of the concerns we had when
good,
we were talking about this.
Yeah, I think that was a really good thing, and that was a good thing that Dr. Morton planned along with the CTC faculty. Because they had to use their relationships to sort of line up those assessments. So we're grateful to that. And then the only other thing is that we were approved for a $65,548 Perkins grant for next year.
Right.
So
Good.
that is all.
Okay. Yay. Thank you. Okay. So that brings us to public comment then. If anyone in the audience would like to make a comment, you can use the raised hand feature in Zoom. Stephen Williamson, I see your hand raised. If you would like to make a comment, just introduce yourself and where you reside in the district, and then you'll have 2 minutes.
Hello, my name is Steve Williamson. I'm from College Township with children at Mount Indy Elementary and Middle School. There are 9 individuals elected that are supposed to represent the entire community, especially when district administration does not. Over the past year, district administration has used the health and safety team to provide guidance for school protocols and the health and safety plan. It's clear from the very beginning that this team did not represent a large portion of the community. They did not represent the educational value that we desire for our children or the concern for the overall health of our children. Their decisions lacked applicable reasoning for the risk to students, and for many students, that caused even greater risk beyond a virus. The 9 elected individuals failed the community when they did not question the reasoning publicly, and the community has been kept in the dark on how these decisions are arrived at. The health and safety team has not been transparent. Why are they not required to submit evidence related to the decisions they make regarding our children? Public view of their meetings is not allowed. Meeting minutes, transcripts, or video recordings are not posted. They have never been held accountable for their poor decisions, and the makeup of the group has not changed to better reflect the community. You should absolutely make sure that the mission of the school is not compromised. This year, you compromised that mission to the detriment of almost every student. I'm aware that there are parents that completely agree with the approach taken, but your duty is to represent all sides, not cater to one side, especially when it compromises the school mission. You need to stay true to your primary mission and give our children the best education with no discrimination in a safe environment, and the latter was never in question. You listened to opinions to make a certain type of parent feel better, while costing almost every child educational value, as well as costing families valuable income and time to manage your negligence. The risk to children, especially elementary school children, is less than 1 per 100,000 to end up in the hospital. I believe Mr. Bach just said there was about 3,000 elementary school students. I am asking that you remove the mask mandates for elementary school students as well, because it does affect the educational value they receive. Thank you.
Okay, thank you for your comments. Jen Moeni, I see your hand raised. If you would like to unmute yourself and introduce yourself and where you reside in the district, and then you'll have 2 minutes to speak.
Did it come back to me again? This is Steve Williamson.
I think I can maybe be able to unmute. Are we able to unmute her?
This is Jennifer. Can you hear me?
Now we can hear you. Thank you.
Okay. Hi, this is Jennifer Money. I'm in Ferguson Township. I would first like to address an error that was stated to me by a board member that the vaccine is not experimental. Let's be clear, this experimental vaccine is just that. It is an experimental COVID-19 shot under an FDA emergency use authorization. EUAs are for investigational use only, for medical interventions that are not fully approved by the FDA. And with that, the FD&C Act states the conditions include communication of known and unknown risks and benefits, as well as the option to accept or refuse administration. The EUA includes constant monitoring, and through this constant monitoring, it has become known that the risks of the experimental COVID-19 shot in the younger teen boy population were great enough that the CDC is this week holding an emergency meeting to discuss myocarditis in boys. We've seen those vaccine risks play out within our own student population in the State College community, where there have been illness and hospitalizations after the shot. Guidance from the World Health Organization says there is, quote, not enough evidence on the use of vaccines against COVID-19 in children to make recommendations for children to be vaccinated against COVID-19. Children and adolescents tend to have milder disease compared to adults, unquote. Dr. Fauci commented on this risk to children, quote, if you look at the data, the spread among children and from children is not very big at all, not like one would have suspected, unquote. Why do I comment on the vaccine? Because these SCASD policies of masking kids are based on vaccine availability. Does that low risk warrant mask policy based on vaccine availability? The assumptions with that policy are huge. Assumes that the COVID-19 risk to student is enough to warrant a vaccine. Assumes the risk of the experimental shot to the child is low enough to offset the low risk of disease. All based on a vaccine that is not even EUA authorized in children under 12. The risks of masks themselves are not zero. There are negative effects on mental health, education inequality, increased risk of bullying. These are risks that cannot be dismissed in this discussion. Based on this, I would ask that masks be made optional for all students, regardless of age, starting immediately. Thank you.
Okay, thank you for your comments. Ashley McDonald, I see your hand raised. If you would like to unmute yourself and introduce yourself and where you reside in the district, and then you will have 2 minutes to speak as well.
Hi, I'm Ashley McDonald, and I live in Ferguson Township. Can you hear me?
We can hear you.
Thank you for your continued hard work. I'm a mother of 4 children, all who attend school within this district. My husband was born and raised in State College, and when we were deciding where to plant ourselves and raise a family, his pride for the State College area school district played a huge role in our decision. I remember him commenting on how this district is top-notch. I've seen many things over the years that have confirmed his claim in my mind, but as of recent, I have seen decisions made by the board and rules implemented that have given me cause for concern. While I only have a limited time here, I'd like to specifically address my area of concern that's pertinent to the current and upcoming decisions to be made by the board in regards to the masking of children and staff. There is fear and there are facts. Fear is used to control and manipulate. Fear says keep the masks in place or we might spread a virus that has a 99.9% survival rate in children. Whatever you fear establishes the boundaries of your freedom. Facts say masks do little to nothing to protect children's health. Medical literature shows that virus particles can easily pass through a surgical mask or cloth face covering. Mask manufacturers acknowledge that their products are designed for the surgical environment. Facts also say masks harm children's health. Medical professionals also note that lack of oxygen because of masking can exacerbate children's health conditions, including asthma, immune diseases, cardiovascular conditions, and diabetes. Facts are also now available after a study done in Florida shows what has been growing on these masks that we are continuing to demand our youngest children wear if they choose not to take this vaccination. A group of parents from Florida submitted these masks, and the report found that these masks were contaminated with bacteria, parasites, and fungi, including 3 with dangerous pathogenic and pneumonia-causing bacteria. Fear says one thing, facts say another. For the sake of our children and the freedom we have in this country to make our own personal health decisions, I urge you to follow the facts. Remove the masks, make them optional for the kids who feel more comfortable continuing their use, but put the decision-making power for health choices back in the hands of the parents and guardians. And I urge the school board and administration to focus on what you have done well for years, educating the students and fostering an environment to learn. That is what school is about. As of June 28th, the statewide mask mandate will no longer be in
Ms.
effect.
McDonald, you've reached your 2 minutes. So thank you for your comments. Okay, would anyone else like to make a public comment? Patty Higgins, I see your hand raised. If you would like to introduce yourself, where you reside in the district, and then you will have 2 minutes to speak.
Thank you. Patty Higgins from Ferguson Township. I'm speaking tonight against the continued masking of children in State College and the tie to vaccination status. Masks should be completely optional for all, 100% of the time, and not tied to the discriminatory practice of vaccinated versus unvaccinated. To date, 16 school districts across PA have become mask and vaccine optional. It's well past time for State College to do the same. Masks are restrictive, disgusting, and useless. They lower oxygen intake, which can lead to acute or chronic injury and worsen underlying health conditions. Lab analysis on freshly laundered masks worn by 6 to 11-year-olds for 5 to 8 hours during in-person school found 83% contamination with antibiotic-resistant strains and dangerous pathogens, things like pneumonia, E. coli, and meningitis. The COVID-19 vaccine, despite the belief of some board members, is still experimental and untested. It does not have full FDA approval. We'll continue to take our chances on the 99.98% survivability rate for COVID-19 in kids by not wearing masks or getting a vaccine that could give them a life-threatening condition or kill them. Even based on VAERS site, there's 358,379 adverse reactions to date have been reported. In kids, there was 974 allergic reactions and 109 had heart inflammation. Kids are getting heart inflammation diseases at 25 times the usual rate. And the 7 child deaths last reported between 12 and 17 years old, only one of them had a pre-existing condition. And it's sad that you can't wait for the vaccine to be available for our younger children. Do not give parents the impression that this vaccine is safe and effective and the only way to take the mask off. Pushing masks and vaccines for healthy people is in no way a health plan.
Thank you for your comments, Ms. Higgins. Aaron Miller, I see your hand raised. If you would like to unmute yourself and introduce yourself and where you reside in the district, and then you'll have 2 minutes to speak as well.
Hi, I'm Aaron Miller. I'm currently in Park Forest and will be moving to the Coral Street zone this summer. I don't have any of these fancy numbers that people are throwing around. I don't really have any of this, science or lack thereof that people seem to want to toss out there. But I do just want to say I think that masks should be mandated permanently going forward. I think that would be great because my kids didn't get sick at all this year. So I just think from a health standpoint that would be awesome. So that's all I had to say. All I had to say. Thank you.
Thank you for your comments. Would anyone else here this evening like to make a public comment? Okay. Okay, so seeing none, then we will move on to future agenda planning. The board will hold a special meeting June 28th. Action items include the foundation MOU, and the agreement with Performance Fact would be for the administrative retreat, not for district-wide comprehensive planning. So it's a more limited contract, but obviously we've talked about in culture, climate, and learning potentially working with that firm for comprehensive planning again in the next round, which is coming up soon. But this is not that on this agenda. The next regular meeting is July 19th, and that
Amber,
will.
I'm sorry.
Yes, sorry.
The safety plan would also be on the
I'm sorry.
agenda.
Yes, you're right.
Right?
Yes, I'm sorry. I should have.
Nope,
Yep. Summer safety plan.
Summer, yes.
Yes. The one that we talked about at length today will be on next agenda for action. And the next regular meeting then is July 19th, and that will include an update on the capital plan funding as well as the first discussion on the fall health and safety plan. Okay. Anything for, yes, Laurel.
Yeah, thanks. I just wanted to, with the item next week, the foundation MOU, I wanted to ask, we got some updated financials, bringing us to pretty much the end of the year, but there were some things when we had done an evaluation or talked about evaluation with Mr. Lieb in May of 2018, and he talked about to evaluate, well, we need to have both the monetary but also non-monetary items that we should, and the ones that I specifically pulled out were the number of touches, number of proposals and their value, number of appeals, number of gift conversations, and documented activity and contacts. And I assume those are all somewhere, But it would be helpful to see some of those as we try to evaluate where we are.
Laurel, have you put those in an email request, or?
I can, yeah.
That'd be great.
I can do that tonight. Sure.
It might help to have a sense of how many board members would, so that we have a sense of the will of the board in terms of gathering that information, unless it's something that is simply available. My question would be in terms of how much, just ours.
Well, if they're not available, that would.
Right.
Right.
Okay. All right. Anything else for future agendas then? Okay. All right. Then moving forward.
Amber?
Oh, thanks, Amy. Yes.
Yep. I think there was still a hand raised in the public audience. I don't know.
I
if
see that hand now.
got
Okay.
missed.
I'll
Sorry.
go back. Okay, Laura Yocum, I see your hand raised. If you'd like to speak, you'll have 2 minutes. If you could introduce yourself and where you reside in the district. And unmute yourself.
Oh, okay. I'm sorry. Do you hear me?
We can hear you.
I had to unmute myself. Thank you. I just wanted to thank you all for your service, obviously, to our community. We are thankful for you. I'm here today as a concerned mother of 4 children. I just have 3 questions for you. The governor's emergency health order ended with the certification of the election on June 14th, 2021. So my question is, why are our children still masked? The governor's mask order based on the emergency health order is set to end on June 28th. And so I'm wondering why there is a proposed continuation of masking for children beyond that date. And then my last question for you. Oh, sorry. Actually, oh no, sorry, 1 second. Well, I actually am not able, I have a lot of notes up here and I'm sorry I'm not able to find my last question, unfortunately. But I just wanted to know if you guys were able to answer me. I'm new to this. I haven't tuned into a ton of meetings. But is there a reason why in the public comment session, as we share and we comment, that there's no response back from you? Is that a normal process of how things are done? And if there is a time where you do comment back on the things that we bring up as concerns, I thought this was a time for us to share our comments and concerns, and then wanting to hear back from you, and wondering if there's a better way to get a response from you on some of our concerns regarding masking in the future, believing, that masks limit educational attainment. As we gave to you on our paper this evening, masks are not a positive aspect for the mental health of children. The virus risks have never merited masking school-age children. And lastly, with bullying, masks create an atmosphere of division and discrimination. And so I'd love to hear your comments on that if possible.
Okay. Thank you for your comments, Ms. Yocum. We've definitely had a practice as long as I've been on the board and prior to the time I've been on the board, which is 10 or 11 years now, where during that the public comment time is really for the public to comment, and that we don't necessarily engage in back and forth at that time, because there's 9 of us and each commenter is one person, and it would be difficult to organize conversation in a productive way if we were all trying to answer back and forth with each comment. And we want to make sure that the public has their time to make comments without, but the potential for, arguments or, contention during that time, so that it really is the public's hour for comments. And that's why we tend to we have never, in my time here, used that time, except on when there's like a quick question that can be answered very simply. But otherwise, we usually try to follow up via email or, in other ways with constituents' questions, or, during, certain times we've had community forums and things like that. So that, I don't know if anybody wants to add anything to that since this question was raised. Okay. Krista Gallagher, I see your hand raised. If you would like to unmute yourself and introduce yourself.
Hi, my name is Krista Gallagher. I have a sixth grader who will be going into sixth grade. We live in Patton Township. And I just wanted to comment. I was really concerned earlier at the start of the meeting when you were talking about, so she'll be going into sixth grade. She will be vaccinated very soon. She'll be 12 and she'll be going into sixth grade at being 12 years old. But most of the kids in sixth grade will only be 11 and they will be not vaccinated, or, you know, some won't get vaccinated, whatever. But so she'll be not having to wear a mask, but she'll be one of the oldest kids in sixth grade starting school. So I was just really concerned when I heard that if she's the only kid in her class that's eligible to not wear a mask because she's, you know, vaccinated, and also because she's 12, I was concerned when I was starting to hear, well, she might have to wear a mask because all the other kids in her class are 11 and they're not eligible for the vaccine. If that's something that would also be implemented in the fall, that was very concerning to me, unless I misunderstood what you were saying. That whole part was very confusing to me, especially for a sixth grader who is going to be a 12-year-old going into sixth grade. So there's going to be kids that are right on that line in sixth grade that will be eligible, but they'll be in, you know, classes with 11-year-olds. So that's something to definitely think about. Thank you.
Yeah, thank you for your comments. Yeah, this was the summer plan, and we'll be talking further about the fall plan in July. Christy Franz, I see your hand raised. If you'd like to unmute yourself and introduce yourself, and then you'll have 2 minutes to speak.
Hi, can you hear me?
We can hear you, thanks.
Great. Christy France. I live in Ferguson Township, and I have 2 kids. One is going into 9th grade, and one might be going into 6th grade at State College. Last year, I pulled her out and put her into a private school. And depending on what the Health and Safety Committee decides going forward to her being a 6th grade, I'll make the decision of whether or not she'll go back to State College or remain private. And I guess my only question is, I listened to you guys talk about these 22 kids and the options that you're giving them. And I think that's great that you are looking for options to accommodate these 22 elementary school kids that parents want to wait till there's a vaccine. And I just ask going forward and that you have the same amount of accommodations when it comes to accommodating parents that don't want their kids in masks, that follow the science, that believe that their kids don't have to wear a mask. And so that an option is out there for kids next year for elementary and 6th grade, that if their parents don't want them to be in masks, whether it's a separate classroom, that accommodations will also be made for them and under the same consideration that you're giving these 22 kids. It's options. And so I just hope that you will look for options if you are going to go against what the PA Department of Health and continue to force kids in masks. Thanks.
Thank you for your comments. Okay. Let me see if is anyone else have their hand raised? I don't see anyone else. Okay. With that, I would like a motion to adjourn the meeting and to executive session.
So moved.
Second.
Okay, that's been moved and seconded. All in favor of adjourning to executive session?
Aye.
Aye. Anyone opposed? Okay, then we are adjourned.